And then I completed my MBBS. And throughout, I was a regular performer with my Guruji, Dr. K. Umarama. And then I got married in my internship, which was pretty early for today's times. I was just about 23, 24. And then I had to choose a specialty which kept my evenings free to pursue my dance.
Wonderful.
I didn't want to get into something which would require me to start to sit in a clinic in the evenings. Suppose you're a gynae or a pediatrician. There's no way that you can stay home in the evenings. You have to run a clinic to be able to do well in your chosen branch,
Okay.
So I said, which branch will give me a flexibility where I can work from 9 to 5, come back home and have my evenings to myself.
Why did you choose radiology? And before you answered that, while I understand, normal middle class parents, like you mentioned, is wanting a son to be an engineer, or rather an engineer and a doctor, irrespective of the gender of the children. But didn't you choose arts? Didn't you choose BCom, BSc, because that would have been easier with your dance as your career, as your passion then?
Only see myself either being a doctor or a full-time dancer.
Okay. Those things were very clear, right?
Yeah, it was pretty clear. And then there have been no doctors in my family at all. And we have had certain, issues where we wish there was a doctor from the family.
Sure.
It was always my dad's, ambition that, there should be one doctor in the family. So he said, why don't you try? If you don't make it, then okay, then that is destiny. Whatever is destined is bound to happen. But why don't you give it a serious try? I said, why not?
And you cracked. You said you cracked your MBBS.
I cracked.
What made you take up radiology and not? I understand pediatrician and all is more of a full-time job. But why radiology and why not a dermatology or some other science? Some other subsection of medicine.
Yeah, right. So when I was doing my internship, as a house surgeon in Gandhi, I would accompany patients to the Department of Radiology. And we wouldn't be allowed inside. I could only take the patient till there and make him sit. So I would peep in and see what they would do. And that was the time when ultrasonography had come in a big way. And CT scan was just, CT and MRI were just about coming. And then it always fascinated me that we could peep into the human body and see what's happening without having to cut it open.
Okay.
We could
I like the way you said cut
the body
open.
from outside,
right?
And then see what's happening in the liver, what's happening in the kidney, and then it really fascinated me in my house job. Because, all my friends would say that I would cut out to be a good physician, because of my communication skills or thanks to dance, the way I connect with people. So they said, you have to be sitting in clinic, you are a people's person and stuff. But then it always fascinated me to be able to peep into the human body and see what's happening inside without having to do anything to the patient. That kind of fascinated me. And then radiology was actually the specialty when I had my post-graduation,
Okay.
So radiology
what is radiology? All right. Yeah. What is radiology? For a student who is just wanting to become a doctor or who's doing her MBBS or his MBBS first year, second year, can you please explain what is radiology? What are the various segments in radiology and how can one build a career in radiology? So 3 questions for you.
So basically, radiology is a very broad term and it's actually an oldish term for imaging. Now it's called imagiology because when imaging started, it started with the use of X-rays, right? So we used X-rays and to look, take a radiograph of the chest, radiograph of the broken bones. So because it was using X-rays and radiation, it was called radiology. But as we moved forward, we started using ultrasonic waves and we started doing ultrasound. We started using MRI, magnetic resonance, and do MRIs. So now it's not just X-rays that we use, but we use so many other energy waves to image the body. So now it's actually imaging. And
Okay.
after imaging, radiology has gone further into interventions where, for somebody who's listening, you would have heard of coronary angiography. What is it? It is putting a catheter. We put a dye into the blood vessels which supply the heart. We image them real time to see where the blocks are.
Right.
Similarly, you can do that to any vessel in the body. Your limbs, your brain, your upper limbs and body and everything.
Got it.
And then if there are any blocks, we can open them up with stents. If there are aneurysms, if there are balloons in the head, in the brain, we can coil them so that they don't rupture and the patient doesn't have an emergency. And also, suppose you diagnose a tumor in the liver, you diagnose a tumor in the lung. So we stick in a needle because now we are in an era where without a biopsy, you cannot treat a patient. So
Right.
it is a radiologist who stick in these needles, get those bits of tissue, submit them for pathologic analysis to get a diagnosis. So basically, we are the doctors who are going to diagnose the patient with their ailments and then give the diagnosis to the treating doctors so they take it forward from there.
Sure.
I understand there's a lot of clinical science and clinical examination, but in this time and age, because it is evidence-based medicine, everybody depends on the diagnosis made by the radiologist to treat the patients. So
All
in
right.
a nutshell, you are the doctor who's going to tell the patient what is wrong with them and tell the treating doctor that this is what the patient has and this is probably what you got to do with them. That's number one. Number two, with interventional radiology, we are also treating a number of ailments and a number of diseases in our own way. So radiology and imaging now it encompasses not just diagnosis, but also therapy.
Right.
Yeah.
All right. So when you're talking of the radiology and the explanation, a detailed explanation you gave, can I understand you do radiology for breast cancer. So
Yes.
a radiologist for a breast cancer specialist, can he move into something like for the limbs or for gynecology, etc.?
Yeah, absolutely. See, when I started my career, I was a general radiologist. I was not a subspecialist.
Sure.
I was a general radiologist where I was doing ultrasounds, I was reporting chest x-rays, I was reporting x-rays of every part of the body. I was doing special studies like, we do the barium studies for the gut to know what's happening in the stomach and bowel. I was doing all of that. I was
Right.
doing ultrasounds of pregnant women. I was doing antenatal, we call them antenatal ultrasound. So I was
Right.
doing blood, I was doing regular ultrasounds, I was looking at CT scans, I was reporting MRI of the brain, spine, the shoulder joint, the prostate. I was doing everything.
Right.
But as we move forward, you got to, because the medicine and each branch of medicine has grown so much
Right.
in its, the vastness of subject is so much that if you remain a general radiologist for long, it doesn't take you anywhere. Number
Sure.
one. Number two, probably with the kind of developments in every sphere, in every organ, you're not going to be best in doing that. You will be able to report to a certain extent, but you may not be, you cannot hit the pinnacle of knowledge and competence in every branch that, if you're handling everything, say MRI, CT, you're doing everything. It's like jack of all trades and
Nikala, your voice is cracking.
yeah. So
Your voice is cracking. You'll have to come closer.
yeah, now it's
So
better.
you'll have to
Yeah.
repeat what you just said. I
Yeah.
can't
So
twice.
what I'm saying is, with the development of science and the vastness of knowledge that is available now, and with the advancement of the technology in imaging, there is so much about every organ that is happening. So
Right.
we are in an era of subspecialization where
Sure.
I do radiology, and then within radiology, we have abdominal imaging, chest imaging, neuroimaging, neurointerventions, interventional radiology,
Okay.
and breast radiology.
Okay.
So it was, as I progressed for about 7 to 8 years, I was a general radiologist.
Okay.
Then an opportunity came in my own organization where they were looking for someone to specialize in breast. And I, being the senior female radiologist in the department, I was asked to go and, train in breast imaging and come back and develop that specialty in my hospital. And then by then I had done quite a bit of general, imaging. So I said, why not? I said, why
Right.
not? Let me go train and come back and see
Mhm.
how I do with my training and how good I am at that.
All
And
right.
then I thought, well, I take it forward. And then there's been no looking back, thankfully.
Right. You are associated with Krishna Institute of Medical Sciences, as we know it as KIMS.
Yeah.
What are the various aspects that you deal with in breast cancer? What I'm talking about is there are four stages, as I know, is in breast cancer. So, what is your area of work in terms of all the stages of breast cancer?
So we at KIMS, as you already know, are our advocacy of early breast cancer screening and early pickup of breast cancer has been our campaign and motto right from the time that the unit was established in KIMS, right?
Right.
So, what is early breast cancer and what is breast cancer screening? Early breast cancer is that when the breast cancer, the size of the cancer in the breast is less than a centimeter or a centimeter and a half. Now,
Okay.
why is it important to pick up a cancer that early? When it is 1.5 centimeters, it's barely palpable. So, what I'm saying is, we want to pick up cancers even before they become palpable to the surgeon's hand or to the hand of the woman.
Right.
We always spoke about self breast examination. I'm
Mhm.
talking of something even before something is felt by self breast examination.
Okay.
There have been a lot of randomized controlled trials done in the Europe and US, where they
Mhm.
have found that if you pick up a cancer which is less than 1.5 centimeters, and if the cancer has not spread to the lymph nodes in the armpit, then the 5 year survival rate of this woman is more than 95%. Now, what do
Wonderful.
I mean by that? I mean, not even 5 years, the 12-year survival rates are between 95 to 98%. Means you're practically talking in terms of cure. So, very rarely we use the word cure in the cancer setting.
Mhm.
But if this is a screen detected cancer,
Mhm.
then I can assure the patient that she is not going to succumb to this cancer
Sure.
with
Sure.
with confidence. you know so my job entails, it's two things. One is screening for breast
Mhm.
cancer. Number
Mhm.
two, diagnostic studies, which means
Mhm.
that the patient has a complaint, say a
Mhm.
lump in the breast or a
Mhm.
nipple discharge or a
Mhm.
simple pain, cyclical pain. Every month they have this very severe pain in the breast.
Right.
So they could come up with any complaint and then we evaluate it.
Sure.
The other limb is woman who's turned 40. I mean, she
Mhm.
just comes to the unit to know if she's well, if everything is fine in the breast. So they just
Sure.
come to do a mammographic screening.
Mammography.
So
Right.
I look at the mammogram. And then if I feel that she would benefit with an ultrasound of the breast, I
Okay.
add that also. If I
Okay.
find something, then I sit them down, counsel them that I've found something which may need further examination in terms of biopsy, where we take out small bits of tissue, send them for diagnosis, and then, depending on what the diagnosis is, we tell them what is to be done next. Right?
Sure.
Gone are the days where women felt a lump, they go to the surgeon, nothing is done, the surgeon will remove the lump, send it for testing, and come back and say, okay, it turned out to be a cancer, so you need a second surgery. So
Okay.
this is now archaic. This is
Okay.
vintage. We do not practice that medicine any longer.
Right. I
Every
like the way
woman,
you put it.
yeah,
Yeah. So
yeah,
in the day and age that we live in today, like a lot of young women want to delay their marriage and also delay their childbirth. Uh, if a woman has breast cancer, can she nurse a child?
Yes, she can. I mean, depending on what kind of surgery she has chosen. Suppose it's a mastectomy, obviously she cannot, there's no breast there, so but she can comfortably feed from the other breast. And depending on whether it's if she has conserved her breast, and
Mhm.
if there is milk let down from that breast, even after radiation, because one must understand that once they choose to do a breast conserving surgery, meaning only the lump and a centimeter of tissue around the lump is removed,
So,
and it is always followed by radiation to that breast. So even after that, if there is milk production from that side of the breast, she can comfortably nurse the baby.
right,
There's nothing stopping them from nursing the baby. They can
right,
very well nurse the baby.
right. My second follow-up question to the same question is: so she's had a tumor, she's gone through a surgery, she's not yet gone through chemo or radiation. Can she nurse the child?
She can. She can. Very well.
Sure.
She can.
What?
There's no relation to cancer, and once the cancer is removed and she's well, she can nurse the child.
She can
And
nurse
it's
the
not
child.
like
Okay.
the cancer cells are going to get into
The
the
baby.
milk, and these are all
Right.
just misconceptions that people have. But
Right.
as long as there is production, and because see, some ducts are going to get injured while the surgery is done. So if the other ducts which are intact are still producing milk, very well she can nurse the child.
All right. I mean, I'm sure these questions may be simple for you, but I would like to answer it
Yes,
on
no,
behalf
no,
of
no.
all the audience.
These are a lot of myths and misconceptions that women have, and this adds to that fear.
Yeah.
That
Yeah.
fear that they have. Yeah, so it's always nice to dispel these myths. Yeah.
Doctor, you have been in radiology for many, many years now. You must have seen patients like my sister who just breeze through it. Patients who are, what do you say, anxieties driven, very, very scared of even a needle. So, how do you counsel them? What are the various things that a patient should understand before she even approaches you?
See, frankly, fear gets them nowhere. I have these women who feel a lump when it is probably just about 2.5 centimeters.
Right.
The fear of biopsy and the fear
The
that
needle
this
itself.
might turn out to be a cancer. Forget about the needle. The fear that, if I go and present myself to a doctor, and if this turns out to be a cancer, so they're going to remove my breast, my hair is going to fall away. So, thinking of all of this, they don't even step out of their house to
Mm.
even get themselves examined in the first
Right.
place.
Right.
For all it could be an infected cyst. It could just be a fibroadenoma, a non-cancerous lump. They just sit on that. Now, unfortunately, what happens is, as you said, there are 4 stages in breast cancer. So once the cancer jumps from one stage to the other, the prognosis meaning the life that they have after treatment with cancer, the disease-free life, the recurrence-free life, or the longevity they have after cancer therapy keeps coming down. If
Right.
I say screen detected cancer, 95 to 98% 12-year survival rate, I'm not going to talk in 90% when I'm talking about a 3 centimeter cancer. I'm
Mm.
not going to talk about survival rates in stage 3 or stage 4 disease. I'm not even going to talk about 12-year survival rates. We are only talking about 5-year
Right.
survival rates, right? So the fear is going to get them nowhere, you know.
Sure.
So, but unfortunately, yes, you'll be surprised. We think education equips and empowers these women. No, education has nothing to do with this. It is the way they are, the way they are
Mm.
made, and also the
Society plays a vital,
family, the
yeah,
family that they are surrounded. The
right,
family plays an enormous role
vital,
in
true,
all of
true,
this.
true.
Talking, talking to them, convincing them, the children, you're talking about a 45, 48-year-old, probably she has a 20, 22-year-old daughter or a son. So, having that relationship where she can openly talk about what she has, and for them to pay attention, pay heed to what she's saying, bring them to a hospital. And then, it requires a lot of talking and convincing, but that's what we are here for.
Right,
So we
right.
tell them that, for all it may not be anything. Just give me that half an hour of yours and we will tell you what's wrong with you.
Sure.
So yeah, we have to convince them to do what is right for their own
Got it.
good. Yeah.
So, even the educated urban society women don't understand what is breast cancer or don't understand how to examine themselves. Point one is, what do you suggest for them? Point two is, what if I know it and I'm like, I'm scared of needles. I don't want to, I understand cancer means death. So I don't want to go and approach a doctor. So how do you address my two questions?
See, number one, knowing what is normal for you is very important. Normal meaning, how does your breast feel before your cycle and after your cycle? Because you must understand, breast is an extremely dynamic organ. Like, see, we understand that every time a woman menstruates, and it's a cycle of ovulation, and then 15 days later she has her period, and she knows ovaries have ovulated and the uterus lining is shedding away. But what we don't understand is, along with all of this, the breast is also undergoing its own changes, because the breast every cycle is preparing for pregnancy. The breast
Right.
is preparing itself to produce milk. Those
Sure.
hormonal
It's
estrogen,
lactating.
progesterone,
Yeah.
all these are having an effect on the breast also. So
Sure.
it's important to know what is normal for you. How does your breast feel before the period
Mm.
and
Mm.
after the
Mm.
now is the era of breast cancer screening. So any woman who is over the age of 40, we advise that they go for a
Once a
mammographic
year.
screening once a year until they're about 60. And after 60, we would call them biennially, once in
Mm-hmm.
2 years, right?
Got it.
With or without ultrasound. That depends again on how your breast is composed. So we add an ultrasound to it. Now, below 40, my advice would be to do a self breast examination every month while you're taking a shower. There are umpteen number of videos on YouTube which explain to you how you have to examine your breast and know what is normal for you and what is a normal variation that happens to your breast with your menstrual cycle. Because unfortunately, under 40, if you do not have a family history of breast cancer, we do not offer mammography or any form of breast cancer screening. But having said that, in our country, more and more we are seeing women between the age of 30 and 40 coming with breast cancers. So I really can't say that, you don't have to do anything. Don't do screening, don't do self-breast examination because it is no longer scientific. We have to offer them something, after they're 30. So I believe that between 30 and 40, definitely a self-breast examination would pick up a lump, if not screen detected, at least when it is less than 2 centimeters, let's say.
Sure.
All
Sure.
right. Even then, it's a T1 tumor. It is still
Hmm.
a T1. Anything below 2 centimeters is a tumor which is stage 1. And
Right.
most likely, it has not spread to the lymph nodes.
Right.
Right.
So
So, yeah.
that was my question. Next question. You rightly mentioned, people within the women between 30 and 40 years. Today, we find young women, late 20s or early 30s, having breast cancer. What are the reasons? Is it just
See,
lifestyle or is it food?
I strongly believe if you take out the genetic predisposition, okay, there is a subset, about 10% of cancers are genetic. One must understand that if you have a family history of breast cancer or ovarian cancer, you may be predisposed to have a breast or an ovarian cancer or rarely a colonic cancer. All right. So family history meaning grandmother on
Hmm?
both sides, paternal, maternal, aunts, maternal aunts, paternal aunts, and your own mother and sisters. So this forms the family history of breast cancer. Right now, if we take out that subset of people who have family history of breast cancer, the rest are all these sporadic cases of breast cancer for whom we really don't have an explanation in this time as I speak. But we surmise that it has got to do with it's either from the air, the Panchabhuta, as I would say. I always say, what is body made of? After all, it's made of these five elements. It's the air, the water, the food. Indirectly, the food comes from the soil. So it
Hmm.
has to come from any one of these. And
I guess
of course,
the soil is filled with chemicals and what
chemicals,
pesticides,
absolutely,
etc.
pesticides. So plastics, are being blamed in a very big way for many cancers. Especially the female cancers,
Right.
because these are all estrogen dependent, and there's a theory that these plastic molecules mimic estrogen, and the body senses it as exogenous estrogen and reacts to it as if it would react to it.
If my family member, my sister, my mother, my maternal cousins, maternal grandparents, grandmother specifically, have cancer, am I a high risk patient?
Certainly, certainly. So, how we stratify risk is that we look at first degree and second degree relatives. First degree meaning mother and sister, your immediate blood relations, your mom and your sisters, older or younger sisters. And second degree would be your mom's sister or your grandmother. Third degree would be your cousins, your aunt's daughter or your masi's daughter, your bua's daughter. That would be third degree. So we say that if you have a single first degree relative who was diagnosed with breast cancer under the age of 40, then you're straight away a high risk.
Sure.
Then if you have two second degree relatives under the age of 50, then you're a high risk.
Okay.
Now, you can ask me, so what? Why is this important?
Right.
This is important because I'm not going to be recommending you the same set of tests in the same interval as I would recommend to a person in the general population.
Mm.
Because when we say high risk, the chance of this person getting a breast cancer is close to 20 to 25%. Lifetime risk is 20 to 25%. And when we say average risk, we are talking about 10 to 12%.
Okay.
And so you carry a double or twice the risk of breast cancer than the general population. So the kind of tests I'm going to do on you are going to be different. And the time intervals are also going to be much shorter.
Mm-hmm.
Right?
What
So
do you mean by time intervals being shorter?
See, for the general population, as I said, some countries recommend breast cancer screening once in a year after the age of 40. Some countries recommend once in 2 years, and some others recommend once in 3 years. Depending on which country you live. But unfortunately, in India, we do not have population-based breast cancer screening programs because the scientific explanation for that is that breast cancer incidence has not attained such proportions that it can be added in a regular screening program.
Okay.
Right? So, but then, as doctors and specialists, we see so much happening around us that we don't think we are very far away from that day when, breast cancer is going to take, is going to take epidemic proportions, right?
Mm-hmm.
So,
That's scary.
yeah, that is scary. That is scary, really, believe me. So as on today, what we recommend is an annual mammogram for the general population, an annual mammogram starting the age of 40, at least till 60, and then you can come once in 2 years.
Okay.
But if you qualify as a high risk for breast cancer, then the recommendations as we speak today are that I see you every 6 months.
Got it.
So I do a mammogram and an MRI of the breast at 6 monthly intervals.
Okay.
Right? So I'm seeing you every 6 months. So if you see me in January, for example, I do a mammogram. And then I bring you back in July for an MRI of the breast.
Okay.
And then take you, do a mammogram in the following January. So I see you every 6 months so that I do not miss cancer that has started, assuming that, today you're well and tomorrow something has started. 6 months is not too far away to get a control on the disease. Okay. So that's where we are today.
What is the difference between ultrasound, MRI, and CT scan?
Okay. Ultrasound is where we use the sound waves. Technically, we use the ultrasonic waves in the frequency of about 3.5 to 15 megahertz, depending on which organ you're interrogating or which organ we are examining. All right. So in ultrasound, we have a transducer, a probe. You must have gone through that ultrasound, right? There is this funny little thing that we rub on
like a mouse
with a gel. Yeah, very, very similar to a mouse. So that emanates ultrasonic waves which hit the organ and then get reflected. So for abdomen and deeper structures, we use higher frequency, obviously, because frequency is indirectly proportional to penetration. So if we want more penetration, we want lesser frequency.
Right.
Now, if I'm examining your thyroid gland, or I'm doing an ultrasound for, these IT guys have this carpal tunnel all the time,
Me here.
I know, that's why I'm saying that. So you guys are on the laptops and mouse. So if I have to see what's happening in your carpal tunnel, then I don't want too much penetration, right? So I'm going to use high frequency for superficial structures and lower frequency for deeper structures.
Okay. So in fact, I have a carpal tunnel syndrome.
So you need an ultrasound. So ultrasound is no radiation. So as I said, we use ultrasound, ultrasonic waves, which do not carry any radiation hazard with that. So we can perform them. It's more easily available. Of course, it is operator dependent because it depends on how much knowledge I have, how much competence I have in interpreting what I'm seeing on my monitor. Right? And then whether I have actually looked at that organ that carefully or not. It is not automatic. It is operator dependent. It depends on the skill of the person who is performing. Now, the next is CT scan. CT scan is again an X-ray based investigation. We used X-rays to do our chest X-ray, a simple X-ray, or a broken bone or a back, a painful back, you do an X-ray or radiograph. So we use the same X-rays, but here what we do is we take cross-section of the abdomen or the brain, we slice it slice by slice and get sections of the body and we interpret those images. So these are all black and white and shades of gray.
Sure. When you, what Srikala mentioned was slice is not cutting slices into like beans or bendi, but slicing in terms of the imaging.
Images. I'm getting a slice by slice image of the organs in the body, right from the skin to skin. So I'm able to see the liver. It depends on how much thickness I have in my setting. Depending on the indications, it's too technical, but that is what we do. We get a slice by slice image of the chest, the abdomen, the brain, the legs, the thighs, the pelvis, all of that. But this involves radiation. So, CT scan became extremely, a household discussion thanks to COVID. Everybody knows CT chest, that is the investigation to diagnose COVID. Sure. So we all got a lot of radiation thanks to COVID. But yes, if there is one investigation that one has to be little wary about in terms of radiation dose, it is CT scan.
All right. Can a lady get breast cancer post-menopause?
Absolutely. Absolutely. breast cancer, if we are not talking about the young cancers, is a disease of the peri and postmenopausal women. Theoretically, I would say, because I've seen so many young now, I don't want to scare people who are watching me, but then, yes, we are looking at a different disease. The disease is evolving into a different one now, but historically and in general population, it is a disease of the peri and the postmenopausal women.
Menopause, yeah. What Srikala is definitely not scaring, but more educative to the audience, to the young audience out there, young professionals, both students and young professionals who are not aware of breast cancer. She's just explaining in detail and not scaring anybody.
Yeah. See, awareness and knowledge is power.
Absolutely.
No matter what your age, you could be 22, 25, 28, 30, 30.
Or even 58.
Anything, you're a woman, you have breasts, you're at risk. Right? So anytime you feel something different, it's always wise to go examined, get evaluated. That's all that I'm saying.
Sure. As a radiologist, as a doctor, what are the 3 very exciting things that you have faced in your career, and what are 3 challenges that you have faced?
3 exciting is
exciting, or that adrenaline jump.
When you're doing your post-graduation and you're training in radiology, of course, in your house job, you do deliver babies in the labor room posting, and you see the babies, the newborn babies. I mean, it's amazing to, as a 23-year-old to hold newborn which you have delivered in the labor room. I mean, that's amazing. But to add to that, I ended up doing radiology where I tell the woman that she's pregnant, and I see the baby go from the time it was conceived to probably a day before it is delivered. And there are times when I've seen the baby, I've scanned the baby a day after it's delivered. So I've seen the entire journey from the time that it was conceived, and it's looking at you in flesh and blood. The baby is staring at you. I mean, I cannot explain that, that feeling that it gives me. It's extremely very gratifying, and you feel so blessed.
But as radiologist, what are the 3 exciting things that you went through?
Yeah, so when I tell a woman, somebody longing to have a baby, and I tell them that you're pregnant, I see the joy in their face, and when they deliver the baby, they come to you and say, "Doctor, this is my baby." Oh, that makes me amazed,
True.
And the other one was when I first diagnosed the first screen detected breast cancer. I remember the lady's name. I cannot reveal for the reasons of anonymity. She was a 50-year-old unmarried lady who was staying with her brother and was working for the national, the NFC. So as a part of our screening, when we started off, we had this bus which was going to all these organizations, a mobile van where we were getting women to do breast cancer screening. So she was 50-year-old and she came, and I read her mammograms a couple of days after it was done. And I picked up this little 5 millimeter area of distortion. So we sent a message to the NFC saying such and such woman who came for her screening needs an additional test. So she came to us. She stays with her brother and family. And I did the biopsy. Okay. And imagine doing a biopsy of a 4 millimeter tumor. It's as good as it can get, and tough. That was my first case after my training, and the gap of size. It's really tiny. And there was a gap of 6 months between my training and me starting to do breast cancer screening. So I was not sure of my skills, and I did get the right tissue. And my pathologist called me and said, "See, you must understand that unless I pick this up and I biopsy it, my pathologist is not going to get a chance to see such a small early cancer.
Got it.
So we are as good as what we see and we get, as a clinical material. So my pathologist called and said, Jwala, I have not seen a cancer as early as this in ages. So she confirmed that it was an early cancer. This was in 2007, December. And believe me, she was in my office 4 months ago, about 6 months ago. And she's doing absolutely fine. She's now 2007 to 2023, 16 years. She's 66, 67-year-old, absolutely fine. And
Wonderful.
then more, that, God has given me this opportunity to save a life. I'm so fortunate that, I have this opportunity to make a difference in a woman's life.
Sure.
It's absolutely thrilling. And
what
number
are the
3
challenges you had?
Sorry?
What are the challenges you went through?
Challenges are difficult patients. Are, the minute you say, I see something, they just break down, and it's so difficult for them to, it's a process. Somebody just walks in thinking, she knows everything is going well in her life. She has a beautiful family. Children are doing well. Husband is extremely supportive. She just walks into the clinic, assuming everything is fine. And here I am telling her across the table, the dear lady, this is wrong with you. This is a cancer, unfortunately. Believe me, it's not easy. True. It's not easy because I'm a woman. I have a family. I have a young family. And you know how important a woman is to the household. Everything revolves around.
Yeah, she's
the fulcrum. She holds everything together, and to see them crumble and just be devastated in front of you is not easy at all. It is extremely challenging. No matter how many hundreds or thousands of women I would have spoken to, every day it is different. And for me, she is an N number, but for her, it's only me. And
for you also, she's a new case. She's a new person to deal with and emotions to deal with.
Some people say, doctor, oh yeah, you see so many every day. For you, it's nothing. No, it's not like that. It's not like that. Because I understand that I'm the only one for her. For me, she may be the 5th case of the day. But I understand that I am the only one for her as on that day in that moment. So I have to keep giving myself this, this morale, the boost. We also crumble. We also feel bad. I have to break this news to a 32-year-old lady with 2 little children. I mean, to tell her that she has a cancer, and believe me, young cancers don't do well. I know everything. But then I have to put up this brave face, and I have to be that pillar of support in that moment to her. I cannot be emotional. I cannot be sympathetic. I have to be extremely stoic, put this across to her, but at the same time be empathetic to her.
Very true.
All that support.
Yeah, very well mentioned that you said empathy, because you cannot be rude, you cannot be stern, you cannot get angry. These are some elements which I think a doctor plays a vital role in dealing with emotions for her own self and for the patients. You're not only dealing with patients, you're dealing with patients' family, and they can get hyper, they can get angry. So how do you deal with the patient's family? More than anger and angst or depression, they get very hyper. So
you have to just calm them down, keep talking, and then that is what that is where all the other things that we do, that we need to do as doctors come in. Even as doctors, because I don't know if I can say this, but this is a lot of negativity. If you're telling her when she has a cancer, she's sobbing, she's crying, the husband breaks down, the children are devastated. So it's not just the patient. When it's cancer, it is the entire family. So you are breaking the bad news. So for me to gather that composure, that strength, I have to train myself to do that. I have to work on myself. Each one of us has a coping mechanism. For someone, it may be meditation. For someone, it can be fitness, running. For someone, it could be nature walks. For someone, it could be music. But we need to look at something beyond the physical to be able to gather that kind of balance and composure, to be able to handle these patients at the same way at 9 a.m. in the morning to 4 o'clock in the evening. You must remember that as doctors, we are human. We also have a family to go back to. I cannot allow this to affect my balance of mind when I come back to a family which is waiting to, share their day, how their day unfolded. So I got to have that patience, not just with my patients, but also with family. So for me personally, it is music and meditation, which I believe gives me that strength and the love of the work that I have. I just love what I do. I love what I do, and I believe this is the purpose of my life. I keep reminding it. Yes, we have our good days, we have our bad days, we have very difficult patients, but then we just got to sit down, calm down, give ourselves that 10 to 15 minutes, take a deep breath, go back
and attack the next day, right?
Yeah.
Like Dr. Srikala just mentioned, it is what is very, very visible in her talk as she's not just a doctor who likes her job, it's the passion that drives her. It's very visible on her face and eyes. That's passion is what drives her every day, irrespective of the disease that she's going through, or she's treating patients. I'm sorry, I'm not going through, but treating patients and their families that they deal with. It is the passion, like she very rightly said, she deals with a zillion amounts of emotions of her own self, dealing with patients, dealing with families, because it's not easy to tell a patient who's just walked into her clinic saying, hey, you got cancer. And nobody in cancer today, till date, despite technology advancement, is still a very forbidden word. Srikala, lovely talking to you. My next question to you is, what do you suggest, advise the young medical students who want to take up medicine, become doctors, not necessarily radiology, but become doctors as neuroscience, gynecology, etc. What is the advice that you would give young doctors?
As I said, and as you said, passion is the key word. And you must remember, you should not, studying medicine entails studying for at least 6 to 9 years. 6 plus 3 plus 3, about 9 to 12 years before you come out as a specialist or a subspecialist, at least 12 years. So you're giving 12 years of your prime life to this subject. So obviously I need not say that the kind of passion you should have, that it has to be immense, and then you should be willing to work hard, and you have to have compassion, because here these are people. These are people in flesh and blood. These are not computers. These are not brick and mortar. These are not wires, right? These are not cash. These are not papers. These are people in flesh and blood with emotions, sentiments, and you cannot deal with them as a job,
Also, you cannot deal with the same with different patients in the same manner.
The same way,
you have to deal with the Srikala differently. You have to deal with
Absolutely, there is no just one right way. There's a certain way I would talk to somebody. I can't repeat the same thing to another lady because she speaks to me from a different plane. So I got to get myself to her plane and then talk to her in a frequency that would match her, the kind of person that she is. And then all this comes provided you have the passion for it. Identify what you like. Remember, this is what you're going to practice for the rest of your life. So you better like what you're doing. Don't do it because it is fashionable to be a doctor, or there's family pressure, or you think you can earn a lot of money. Believe me, if you think there is a lot of money in medicine, I'm sorry, no. There's not a lot of money in medicine. There are 100 better ways of making money, and much earlier than you would make money in medicine, because by the time you just qualify and come out, you're going to be 28, 30. And then that's when you have just started. And you look at your engineering colleagues who are, who have a 5-digit annual salary, they're going to be in depression, This is not a profession that you should come for if money is your aim. There are 100 different ways of making money. Yes, you will make money also, but primarily understand that you're investing 12 years of your life. So you got to love it and enjoy it and have a passion for this and have a love for humanity. You should
money
love
is
people.
Not just the factor. Money is one of the probably
money
the
is
factors.
One of the things. Money will come. Money will come. Medicine as a career assures you of a decent living. It doesn't assure you richness.
Luxury, yeah.
Understand? Luxury. You will have a good life. You will have a lot of respect in the society. You are, as doctors, when everybody knows that we do derive, but then that comes with a lot of hard work, passion, and commitment.
And compassion, like you rightly said.
You can't do it like any other job.
Right. And for all the weak hearts or the girls or boys who run away from medicine, please run away from injections. Please don't take medicine. Yeah. Last couple of questions. How do you manage to have work-life balance? You also mentioned, and I know you personally, that you are a classical Kuchipudi dancer. My first question to you is, do you still continue to perform? Second is, how do you manage to have a work-life balance? Work-life balance, not just work and home, but work and a second career in terms of Kuchipudi dance.
Yeah. So luckily for me, as I said, by the time I came to my 12th standard, I was, I was a pretty decent performer. So, I was through my basics and I was performing regularly. So through my medicine, I continued my art. I never bunked my dance classes, citing difficult, exams and stuff like that. I know my mother, I should thank my mother for that, because, it might sound very cliched, but time management is the key.
Okay.
I tell my children also that this moment, as I'm talking to you, I look at it this way. This is time away from home, from family, from dance, from my work, right? So the value that I attach to this moment in my hand is all that I'm depriving myself, which I enjoy much, much more. So when I think of it that way, this moment becomes extremely valuable to me. Right. And I give my 150% to this moment in hand. This is something that my mother drove into my head, that the moment in hand, once gone, is gone forever. So make the best of it. I mean, you'll be surprised. I performed through my board exams in my 10th. There was this gap of 3-4 days between exams. And I had this very prestigious performance where I think R. Venkatraman was the president of India. And I was playing a very key role in a ballet, which my guru had choreographed. And she wanted me to perform. In between my exams was the day of the performance.
Sure.
She told my mother, and she said, why are you even asking me about that? You should just go dance and come. What were you doing the entire year? If you cannot pass an exam if you didn't study one day before the examination. That's so sad. And I was like, okay. I went ahead and performed. So it does take, but then if you love doing what you're doing, you wouldn't do it any other way. Simple.
Absolutely. Do you still perform?
Yes, I do. Not like like
Uh,
your sister, but then yes, at least 5 to 6 shows a year. And I try and teach a few students in the
mhm,
weekends
mhm.
because I took over as a director of my dance teachers academy after
Oh,
she left. So I have a
congratulations.
few students. So I run a dance school. So I take dance classes twice a week, and I keep it alive because that's where I completely unwind.
Absolutely.
Dance is
You've spoken like
that's
my sister has. I completely resonate with what Srikala mentioned. I come from a family of art. My sisters have been are Bharatnatyam dancers. Sorry, I repeat. Varshini, you'll have to edit that. So my sisters are Bharatnatyam artists, a very well-known, renowned artist, and Ananda Shankar, has had her corporate as IRTS officer and a dancer, and she's managed both simultaneously. In my own way, I am a HR professional and do podcasts, write poetry, etc. So the context of not having time doesn't come into the picture at all. Yes, like she rightly said, you'll have to manage time, you have to allocate time, and you can do 10,000 things at the same time. My last question to you, or second last question to you, is what do you wish to do in future as a doctor and in terms of your Kuchipudi career? I would like to believe it's a career.
um, I do a lot of diagnostic work, but in the next phase of my career, I would like to do more work on the field. Reach out to these women at the taluk level, at the village level, uh, you know, maybe, train people to go and, teach them the importance of breast cancer screening or self breast examination in case they don't have access for mammography. Try and see if we can kind of, try and get a mobile van for breast cancer screening in the, underprivileged women in the villages and in and around Hyderabad to start with. So I want to take the next phase of my career into, to be more socially relevant, not just sit in the hospital. Of course, that is always there, but because that's where you are actually looking at patients with breast
Mm.
cancer, diagnosing them. That
Mm.
is also important.
But
And
you want to
this
reach out to more people.
reach out to more people, advocate, take the breast cancer screening advocacy forward, give a thrust to this campaign, educate women, both rural and urban. I don't believe urban women are any wiser. They are as foolish. I'm sorry, but I know because I've seen them. You sometimes wonder they're so educated and how dumb can they
Mm.
be? When it
Mm.
comes to their health, their body, you'll be surprised how dumb they can be
Well
sometimes,
said. Well
probably
said.
stemming from a deep fear inside them, probably. That's what I think, and just forgive them for that, but then try and educate the young women, because if I'm talking to a 22, 23-year-old, I'm educating her. At the same time, she is going home and looking after her mother, her sister, her grandmother. So I want to empower these young girls, especially in corporate offices, in IT offices. We do that, during the Women's Day celebrations and the
Mm.
Women's
But it
Day
should
month
be more
or
often.
Breast Cancer Awareness Month. So I want to reach out to these young girls, educate them about breast cancer, and then also educate them that cancer now is not synonymous to death. There's so much
That's like,
happening in cancer therapy that you don't have to think of
yeah,
succumbing to the
yeah,
disease.
yeah.
There's so much we can do. Yes, it do go through a bit of pain and a little bit of, you know, You have to attain that, but then after that year or two, you're completely well. You have an entire
Absolutely.
life ahead of you.
Absolutely.
So cancer now is not synonymous to death any longer. So
True.
one has to get that myth out of their head. So I want to work more in the public, and have more work relevant, socially. So that's where I see myself going in
Sure.
terms of being a doctor, and especially how breast
Right.
imaging happened to me is a story by itself. So I believe I'm here with a purpose. So I think that's where I think I should be going, and then he'll take me there. And then as regards to kuchipudi, I'm teaching now, and then I'd like to probably train
Expand your
students
school.
academically, maybe prepare them for examinations,
Sure.
prepare them to take kuchipudi as a career path, train them academically in kuchipudi, maybe for a BA or an MA dance and PhD in dance, events that kind of interest in them to take up art as a career. If I can manage that. And then of course, in breast imaging too, I want to train more and more radiologists in breast radiology, because among all subspecialties in radiology, breast imaging is quite nascent, quite
Mm-hmm.
young,
Mm.
and not many radiologists understand the importance and its potential for the future. So I want to train more and more women radiologists, or male radiologists who want to take up breast imaging.
Sure.
I want to train more of them, and bring them into this society for the greater good of
Sure.
women in this country.
I think from my end, I would love to introduce you and invite you to various corporate organizations where you can come and educate the young women, both men and women,
Thank you.
because men can also go and educate their mother,
Absolutely.
sister, brother, whatever,
Very
mother,
well
sister,
said.
grandmother.
Grandmother,
It's very
wife,
important.
parents,
I will
spouse.
Yeah, I will definitely take it up and introduce you to various corporate organizations. Depending on your time, I would love to
Sure,
have
sure.
you
Thank
come and address them. And if I don't do it, please ping me and say, hey, please introduce me. I would love to do it. So it was wonderful talking to you, Srikala. Thank you so much for being our guest today. You have
thank you.
really opened up many areas where people are kind of having a negative image on breast cancer, the seriousness or the disease per se. And I think you have also opened up the fact that it can be very, very positive. So thank you so much. It was wonderful talking to you. Thank you so much.
Yeah, my pleasure. Thank you so much for having me on your show. Thank you.
Srikala, can you please let us know what are the various awards that you won in your entire career so far?
Yeah, so I'm a recipient of Annamacharya Scholarship. And then I have been an invited performer at the Khajuraho Dance Festival. And I've had a title of uh, Nritya Chudamani from Pushpagiri Swamiji from the Mutt.
And
And
your awards as a doctor?
doctor, I've my paper was adjudged the best paper in our national conference as a postgraduate. And then I've presented a lot of scientific work in our prestigious our national journal, which is the Indian Journal of Radiology and Imaging. And then I'm a very avid speaker in a lot of our CMEs, the continuing medical education. And then I've held a very high position in our breast imaging society. And some of my papers and my work have won gold medals. So,
Wow.
yeah.
Srikala, it was wonderful talking to you. You have explained in detail what is breast cancer. You have ensured that people are not going by the myths. You have explained or opened up various ideas, various thoughts in young women. and they should not look at breast cancer in the negative manner. And there is huge amount of potential of life after cancer. It was wonderful talking to you. Thank you for being a guest. Like I mentioned, you are our 10th guest. It was wonderful talking to you. Thank you so much.
Thank you for the opportunity. Pleasure is all mine. Thank you so much.
Thank you.
To stay informed about the startup ecosystem, subscribe to My Startup TV.
The Leadership Talk series, wherein we are interviewing leaders across domains, verticals, industries. This is going to be beneficial for young professionals, management students, engineering students, and students across various domains and various subjects. Today, our guest is Sriram, has done his graduation in applied sciences, went on to do his specializing in finance and marketing, and has worked predominantly in HR. It's a very interesting career that he has had so far. And the last 1.5 years, he's quit the corporate sector and has become a happiness coach. Let us understand his journey. Welcome, Sriram. We welcome you to My Startup TV. We are doing this Leadership Talk series in collaboration with My Startup TV. And like I said, you've done a post-graduation from Bharatiya University. Please walk us through your journey.
I started in 97. I joined Mercedes-Benz at that point of time, and it was a marketing job. And I quickly realized that that was not where my core strengths were. And it took a few years for me to then shift from there to Infosys. And at Infosys, I found my path in a way. And at that point of time, Infosys was recruiting for people, from sales backgrounds. That's how I got into HR. And since then, it's gone 24 years now. I've been in HR, various kind of roles. In Infosys, I moved across locations. And then from there, I moved to a company called Shaw as head of HR in 2009. And then we split the Shaw into two firms, and I went to the startup called RCZM in 2016. And then I got out last year to really pursue my passion, which is around the theme of happiness at work, happiness with individuals, and so on.
What are the aspects what are the facets you have taken care of in the HR domain? My second question is, for the young students, management students who have specialized in HR, what do you advise them? What is the career path they should choose? Who have chosen HR?
Start with, what I've done in HR. I started with recruitment. I slowly moved into employee relations. From employee relations, I moved into development center management. From development center management, I was part of the team that created business partnering HR at that point of time. From business partnering, in that role, I was anyway doing a little bit of training as well. From there, I then became head of HR, which was a larger portfolio with compensation, benefits, all of that came in. I think you, as a student, if you're kind of getting into HR, now what's happening is that there are specializations within the domain itself, and a recruiter core skills are probably different from a compensation specialist versus somebody who's business partnering, because all of these have a slightly different front-ending competency. Like a recruiter has to sell the job to the candidate. A compensation benefits specialist has got to have the data mindset, where their accuracy, the ability to analyze is very important. And whereas a business partner is somebody who can relate to people, who can kind of get. So there are, in HR itself, there are these variants. So it's not one job.
Different segments.
There are several pieces to it. The key is to really figure out what is it that I excel at, what makes me come alive in that, and then quickly try and get closer to that to the extent possible. In any job, there's always a mix of things that you will do, but it is about knowing your core and doing more of that.
And learning.
And learning. As part of that, any job will have to have, expertise. You have to invest in learning throughout, and that is not a journey that ends at any point. For a youngster or at any point, learning is important because things are constantly changing.
Right. What is the difference for a young student who's in the first year or the second year? Colleges unfortunately don't prepare the student for the corporate trend, for the corporate business. So what is the difference between HRBP and what is ER? And my second question is, can I just get into HR and not into HRBP or ER?
Okay, so again, these are nuances where, I would say if you're getting in and you're keen in an HR career, just get in and gradually navigate your way through the processes. But to answer your question on what's the difference, a business partner is somebody who's working closely with the business, and hence they are driving the business's people agenda, which is, so how do I achieve this business goal through people, and how can somebody help me with that? That's really what the business
partner.
Can you elaborate, please? Okay. So if somebody is a business partner, then they work closely with the business unit head who will say, okay, listen, my attrition in that particular team is high. Okay, I need to contain that. Can you help me? And then the business partner kind of gets into that. Then they look at the data from an external perspective. There is a manager who's already there, who's doing the job. But then the business partner comes in with a slightly outside view with the intention of helping you. Sure. And then you look at that thing and then you realize, okay, problem could be the manager, problem could be the kind of work, problem could be the type of people we've hired. And hence they are able to then come back, look at it very objectively, and then influence the change, saying, oh, people need to be trained, or the manager needs to get some perspective, or the business needs to take care of people better or give a slightly different job. So that is how a business partner tries to influence it through different facets of analysis, influence, training, coaching.
Interesting point that you mentioned is it could be a wrong hire as well. What is that and how do we rectify that? Or how do we fix that? Supposing an employee or set of candidates have joined the company and they don't fit into either the culture or the job. How does an HRPP fix that?
Okay. But it's not an easy fix first. I think, we should agree that sometimes, everything doesn't have a very easy fix. This is one of the problems, but it's a real problem. And there are few ways to look at it. First, I think the most important thing is to understand that it is a wrong hire. Many times we just don't want to accept it or don't want to acknowledge it, and it takes a while to, get that going. So first is to acknowledge, say that, okay, it's not working. Once there is a clear understanding it's not working, then you have some options, which is that, can this person fit somewhere else with what we have? If that is the case, then make the movement possible. Sometimes it's available, sometimes it's not. Then it could be an issue of, can we train the person, reskill them to what we have? That will require some effort. That will also require some effort from the individual, because they need to also invest and say that, okay, I am willing to be part of this reskilling. If that's possible, then you do. If none of that works, then I think we should say at some point, saying that, okay, it's not working. I don't have the opportunity. You are not ready for reskilling. Then we need to take it to a logical closure of saying that, okay, let's just part ways. But with a reasonable conversation, giving them the time and so on. So it's always real. Keep it real is my thing. And to the extent possible, we must always treat people well. Whatever the situation.
Absolutely. Since I come from an HR background as well, I completely agree with Sriram that you have to treat people well. It's not that cannot be hire and fire. My next question to you is, Sriram, as once an employee joins in the let's say one candidate or student joins in the recruitment department, can he move into comp benefits or ER or PMS, etc.? And how?
If somebody comes in a thing, there are two types of growth which are possible. One is grow in the same line, or grow across and then move and then grow. Okay?
Laterally and
then vertically. So now the question is, first is that you don't want to make these movements based on whims and fancies of saying, oh, I saw that person, they achieved that. That's a different story. when you match your passion and your skills, and then say that as part of what I want to achieve, I think that will add to my, dimension of.
You also are talking about have fixed or set goals and then achieve your goals.
And always rely on who you are and what you can influence the most.
Your core strength.
The core strength. See, if you are an extremely good recruiter, and then you say, I want to become a compensation specialist who's going to sit and work in front of the computer and data all the time. Now, is that really good for you? That may give you a temporary growth because that may be a role which is slightly elevated from what you're doing. But eventually, if it's not tallying with who you are and what you're good at, that's not going to give you growth. So that is the illusion that we must not succumb to, but really look at it from saying that, and today growth is possible. And that's my whole message is become an expert, become excellent, pursue excellence. Expert is that you really know your domain really well. And this whole thing of I spent 2 years, I spent 1 year, I know everything, that's not enough. Okay.
Very rightly said, because youngsters today want everything in very short time. It's not, life is not 2-minute Maggi noodles. So what is the advice that you give them?
See, I am all for energy. I'm all for, the need to grow, need to learn. But I'm also for realistic, practical patience. And because what we often think is only one dimension of intellect, but there is social intelligence, there is emotional intelligence, there is, and all of these are part of your growth. And some of them take time. It requires maturity for you to deal with people. You want to lead people. You have to inspire people. How can you inspire people with an intellectual knowledge? Unless you've really gone through that yourself. Right? And that's what people sometimes fail to understand. We are somehow too caught up in the intellect part and say, oh, I know it all. As a thing, most of it is coming from internet, from, that's not enough.
True. You have to not just learn from the internet like you mentioned, but you also have to be soaking and learning hands-on. My next question to you, Sriram, is if one gets into compound benefits in terms of growth and there is an opportunity, I would very strongly advise that student or that young professional to learn Excel thoroughly. Beyond just learning, what else can he do to grow vertically and laterally?
Important is to network and get to know what is happening in there. Because sometimes we are like that frog in the well. We think, I know everything, but you have to get out of the well. Then you know, oh my God, there's a huge world out there. And then there are so many more things to learn. And then ideas come like that. How did Steve Jobs, put a brick phone and your Walkman and a computer together? That's creativity. When different things come in and then you're able to make something tangible of that in your workplace. That is creativity and innovation.
I will just add one more point to what Sriram just mentioned is beyond just wanting to grow into another role, you also have to ensure that you value add to that role. Because there will be 10 others. So what is the difference that you are going to create for that role? Do you want to add to that point?
See, when we want to value add, we must also have a little bit of humility. Okay? Because sometimes what happens with intellectual knowledge is our ego kicks in, you become arrogant and you start thinking they don't know, I know. Right? But influence is not that. When you want to really make a difference, the biggest thing that you get as you go higher in your levels is that realize that I have to influence.
Absolutely.
And if I have to influence, I need to work with the person who's opposite me. You have to get into their mindset. You have to understand what they're going through. Then tweak what you are saying, what you want to their language. And that's a lot of effort. It's not.
And that's not just your colleague, but your juniors. And your juniors probably 10 years down the line. 10 years junior training.
Because knowing is not enough. It is to get people to do things as well as you.
Very true. It is very important to connect with youngsters, not just in the context of saying hi, how are you, and things like that, but context of saying go down to their level, learn and be adaptable, adapt and adopt. That's my philosophy all the time. You also have worked with Mysore Infosys, and that was that was a job that was given to you, which you did not want to take. Can you please?
I was just extremely reluctant to move. But then my boss, who was much more senior and older, called me and said, "See, these kind of opportunities don't come off. You must take this up if you're serious about it." Okay. And I know the people who are there; they will take care of you. You will really kind of. So based on his maturity and his kind of thing, I took it up a little reluctantly. The first day I landed over there, exploring and saying, "Okay, what have I got myself into?" Then it turns out the next 5 years of my life are probably best. Okay, just because of the fact that I really enjoyed that experience with the people that I was working with the freedom I got, with the amount of stuff that I was able to really kind of. And the fact was that I took that risk. I was willing to kind of say, okay, I'm serious about my career, and even though I wasn't really kicked about doing it, I did it, and then I realized that's what I got to do. And sometimes people are too stuck on with the location, with the circle, and so on. If you really want to grow, you have to go after. Yeah, go after where your growth is. Don't be like shut in a thing saying, "Oh, this is what I can do. I will not do that," and all that. You go try it. If it doesn't work, then it's okay. But most times, in that trying is where you go out of your comfort zone. Right. Then you realize, "Oh, I'm actually good at it."
There are two questions that comes to my mind. One is, how does one take risks? Because risks is something which we get claustrophobic and don't want to take that. Second is, that could be the second question. The first question is, what are the various rules that you take in your Bangalore's tenure?
I'll answer the second question because it's easier. Okay, so I started with the development center HR, where I took on a business partner. We lead for a big kind of unit. By the time I left, actually I was leading 2 business units, and then I moved to a bigger center as the head of that location. So all those kind of movements happened, but the big thing was that I had the leader of one business unit sitting out there. He was absolutely inspirational. So many things that I've learned from him, which I still kind of value a lot. So that's the second easier part. Risk taking. I've taken the biggest risk of my life last year by moving out of corporate into something which is kind of thing. Now, how do you make that decision? Right? One is to really know what you want. That I've always known, and I've known for about 7, 8 years that these are the kind of things I want to do. I want to teach, I want to train, I want to coach, I want to write. Okay, and I want to make a difference to a larger audience through who I am and what I know. So, and through knowing that, also it took me some 7 years to actually, be willing to take that risk. So it takes time to kind of, but it's not about taking a foolhardy risk.
That's very nice.
It is about being practical, saying, I'm passionate about this, and at this point of time, can I do it? Okay, do I have the little bit of financial support that can help me take this risk, which is important, so that we don't, kind of just blindly run into something. But beyond that, there is an element of knowing that I have to go all in this, give it my everything, and really make it work. If you are really passionate about something and that's aligned with what you are trying to kind of get into, and if you're willing to have the patience to wait and go through the grind, that's where your whole point, that resilience will test you.
Resilience, persistence.
And because in that process, it is not just for the heck of it, right? In that process of resilience is where you grow. It is where you think out of the box, where you're saying, okay, how can I do more? How can I reinvent myself? How can I, kind of make a bigger impact? So that comfort zone goes away because now it becomes survival.
So I like 2 more adjectives of there: resilience, persistence, and consistency.
Yeah, right.
I'm sure you agree with that. When you were working with Infosys and you went to Mangalore, I understand your journey.
Yeah.
You then moved on to D-Shaw.
Yes.
Can you walk us through that?
So D-Shaw was entirely different, right? So Infosys had been almost 10 years, and I had the best experience for a while, and then I felt like I was not growing and I needed a change of thing. And this was a good role, it was a head of HR role, but it was a completely different culture. So it was an MNC, it was a hedge fund technology setup, extremely top end. That is that you have the top talent in the country, very well paid, and at that point of time, HR was kind of irrelevant. It was all being run by mostly the business and what they thought was right for people. And so from a process to policy to benefits to, getting the team right, to really making, they had a good culture. It was not that they had a bad culture, they had a good culture. But HR was not the driver of many things over there. So while it was there, it was not really something that was seen as a very important function. Right? From there to really now, even now, if there are people who will talk about things, and now people who moved out and gone to other companies, they say that we still talk about the culture that was there when you were, kind of managing HR there. And through that, I'm now getting some business also because people are saying, okay, sure, I want my HR person to talk to you as a thing. But that was the kind of thing we took from. It was like, it had good ingredients, but HR wasn't very good. So we built that whole thing, and they were willing to, they were not a very stingy firm, so they were willing to spend money. So it gave me some freedom to kind of operate. And I think we really took it to, I would say at that point of time, 2009 to maybe 2000, 3-4 years, we were among the, top companies in the country.
D-Show was a very predominant company and it still is. Going back to the risk point of view, young professionals, youngsters today, after the graduation, they want to become entrepreneurs. What are the 3 salient points that you will advise for the young professionals, young students who want to become entrepreneurs, or even the young professionals who just 2-3 years in the career, they want to become entrepreneurs?
The why is extremely important because you don't get into it for the fact of it. You don't get into it because I don't want to be part of corporate. You don't want to get into it because I don't like my manager. Okay? All those are not the right reasons. Certainly, that's the first element of it. Now, if your why is good, second is, are you willing to take risk? Because you know for a fact that not everybody makes it. In that journey, a lot of people fall off. Many more people fall off than the people who make it. We don't know the stories of people who make it. We don't know the stories of people who don't make it. But there is enough data to say many people don't make it. Okay? And that's a fact of entrepreneurship. Are you ready to, so if you're looking for success and not willing to do what it takes to succeed, that's not a journey for you. Then you're better off in a place where you will continue to get a steady income, and that's not a bad thing. Right? It's just knowing what I'm ready for. Right? Third is that when you are an entrepreneur, it is a multi-faceted journey. You have to do everything. Right?
From the janitor to the managing director.
Correct. You have to do everything and be okay to do everything. Right? And those are the 3 elements. And if you're willing to go all in, if you know that this is why I want to do it, and if you have the resilience, persistence, and the risk-taking ability to kind of sustain it, then it's a journey. Don't go into entrepreneurship just because you have an idea. Oh, I have an idea. People have millions of ideas. You know how many thoughts everybody gets about 60,000 thoughts a day. In the 60,000 thoughts, there are some 2-3 ideas that people get. It is not the idea. It is that I am willing to make this idea work and I am willing to do whatever it takes. And I believe it.
Right. When a student or a young professional wants to become an entrepreneur, you have to have the funding capacity. It should be coming from the family or yourself. The second, very long way down the line, maybe 5 years, you will get venture capitalists who will fund you. So what is the advice you would give the student to prepare to become an entrepreneur? In both context of his abilities and his financial abilities.
So first let's talk about what is in the control, which is your abilities. So remember that the entrepreneurial journey is a multi-faceted journey. So you need to know a little bit of finance. You need to know of marketing. You need to know your domain. You need to know the product. So you have to now, because many times why the entrepreneurial journey works is because you're not willing to look at the other domains because you have an aversion to it. Oh, I can't deal with numbers. I can't. This is one story. Okay. You think that the vendor on the job he needs all those capabilities. Apart from selling, sourcing, quality checks, customer relationship. He's doing all of that. You have to do all of that. Okay, so it's simple equation. Where are you ready to do? Because some people say, no, I'm only interested in the idea and talking about the idea. I'll not do anything else. That's also okay, so long as you have the expertise available at, for you to somebody else or from anybody else. Then it's kind of still, kind of okay to be able to build the.
I'll interject you here. If you were having 3-4 people like Sriram mentioned who can join your team, they should also be in the capacity to not be earning a single rupee for the next 6 months or 1 year.
So I come to the financial part, but even if you have 3-4 people, the best combination is to have complementary skills with some overlap. So it is like you take 2 circles, there is an overlap, okay, and then but then you have, you form like a chain. Right? That I can do product, somebody else can do digital marketing, somebody can do finance. Okay, then it's an extremely good. If all of you can do the same thing, you don't have too much, kind of thing. So think of that aspect as well. Now, the financial aspect, right, which is that if you believe in the idea, go all in, give it everything. If you need to borrow, do that as a thing, but understand that it will take time. No good thing in this world ever got done in quick fix. Nothing. Nobody, including what you see as success stories, have all gone through those journeys of, kind of in their own way. They've had to struggle, right? You will also have to struggle. So there is no running away from that thing. All it is to be realistic, saying that the struggle, how much time are you willing to give yourself? Okay, and I would say a reasonable time is anywhere between about 2.5 to 3 years is a good timeline to really be prepared for, to give everything, go after something, make it work. And at that point, if it doesn't work, then you should know that this is not. And because there's always a time when you abandon ship, right? If you wait too long, you crash, right? So you don't want to crash also. So, but 3 years, I would say, is because the incubation, the whole thing. But by the time you kind of get into second year is when actually things start moving for you. And by the third year, you know how much it's really going to take off or what is going to happen, right? And then you know, is it working for me? It's not working for me. And kind of at that point, but are you willing to give yourself to this? Are you willing to go all in? If you are willing to do these 2 things, then it's worth.
Going by the last point that you mentioned, are you willing to give that kind of time? If for whatever reasons, the entrepreneurship business or my role in a particular job, specifically entrepreneur, does not work out. I'm asking you in the context of young professionals succumbing to pressure. What is the inputs you want to give the young professionals, students, and not necessarily just young professionals. We had Cafe Day, CMT committing suicide. So what is the most important things that students, young professionals should learn and not succumb to pressure?
Remember, life is too precious to be wasted. Doesn't matter. What we think of failure is a construct. Okay? And you know how many times Babur attacked before he became successful. If you go back into history, there are so many failures that, we celebrate the victories, but there is so many things that came, even with the most successful people, even who you revere as people who think, like Steve Jobs, he went into hiding. He was, chased out of his own company, and he was like, out of that before he came back into it. So there is no thing saying that this is a failure. Yeah, there is a learning.
There's a journey.
There's a journey. In that journey, there will be up and down. That is the way of life. And if you live long enough, you will know that as you go down, you'll also come up. That is how it is. And sometimes the pressure goes up. And at that point of time, you take help to understand that it will pass. You stick through it. Be through it. Whatever has to happen. Okay, what's the worst that can happen? Your money will go. So what? They can come back as a thing. But life cannot come back. Okay, so many times, and I see this with kids also, right? Because the expectation that is built up, you try to match that expectation, and sometimes because you fail that expectation, you suddenly feel that I am a failure. There is no such thing as failure. There is only trying and learning.
Failure is a stepping stone
to success, because that is just, I just look at the word failure as a learning opportunity. It's a new opportunity to learn. Okay, so as long as you look at that from a thing, and everywhere there is learning, that's the mindset that when you have that thing. So for people who are under stress, one is that first be reasonable with your expectations. Second is do what you're good at. Follow your passion. Know where your core strengths are. Follow that. Because if you are doing what you like, even if it doesn't get you the money, you still enjoy it.
Yeah, money is not be all and end all. Having said that, as long as you upskill and reskill, money will come to you. Not today, tomorrow.
I believe in this thing that value is always, there is a way in which the world works, and that way that works is that you give value, you get value. Simple equation. Okay, so it's always the question is, am I giving enough value? If you give enough value, the money will come. So don't focus on the money coming, focus on giving value.
This talk that you just gave is leading to the success, you becoming a success coach.
Yeah.
What is success coach? What are the things that you cover under this platform?
Right. So I'm of course focusing both on the individual and the corporate. And for the individual, I'm calling it peak performance, success and happiness. Okay. Which is that first is before we kind of expect somebody to do something, we fix ourselves. How do you fix yourself? Fundamentally, there are three elements. You fix your mindset, you fix your behaviors, you fix your habits. If you can do these three things, your success and your element of earning money, all of that will follow. It is easier said than done. Okay, and it's a journey. Your entire life can be a journey, and these things may not be fixed. So the mindset is all about what I believe, what my values are, what my virtues are, what my purpose is, and really always kind of aligning yourself with who am I, how do I become the best, and how do I keep thinking about it in a positive way. Second element is saying, how do I become a better human? How do I keep getting over my limitations and my cheap behavior and my cheap thought process, evolve beyond that. Third is,
what if a person is constantly, wallowing in self-pity and negativity?
That is the element of mindset, right? Where you not elevated your mindset to understand, what is possible for you. Because why are you in a negative mind space? Because you are either caught in this is happening to me, people are doing this to me, and all of that. And this whole thing, somebody or the other will do something to you. It is to get out of that whole thing and say, I own my life. I am creating my life. I am willing to do what it takes. That ownership, accountability for your life comes, and that is the first step of the mindset. The last part of it is, I always recommend that go after your habits. Okay, fix your day. If you do enough good things in your day becomes happier, and as you build momentum, eventually you move towards a happier life because the solution is in your day. And what you do in your day is fix the parts of your day so that you put in good habits. Good habits,
How does the young student in their 20s have a fixed schedule, and how can he improve his life better?
First is understand that if you want to be successful and make a lot of money, you have to fix your life and your day. Okay, now your day starts with sleep. People are sleeping at 2 o'clock and saying, I'm waking up at, this time I sleep for 5-6 hours, I'm superhuman, all of that. You're not superhuman, you are just shortcutting your life. Okay, don't go up at all that thing, because sleep is so powerful. People don't understand the science of sleep. Need 7.5, 8 hours of sleep. Very, very important. For you to have the energy you need during the day. Then what do you do with your mornings? The mornings are an extreme, that's why all, kind of religions have always focused on the mornings. Do your yoga, do your pranayama, do your, gratitude, all of that. Because the mornings have some, special power in terms, because there is science to it. The morning, if endorphins get released in your bloodstream, they stay in your bloodstream longer. And thereby, your mood gets affected. Your mood generates your thoughts. Your thoughts drive your actions. So these are all interconnected very beautifully. They didn't explain all of that. They said just do the yoga, do the meditation. Right? So you start with your day.
So you're saying Surya Namaskar is the best way to start your life?
Yes.
Saturday, sorry.
Yeah. In fact, if you can do 12 sets of Surya Namaskar, what happens is that the body releases endorphins at the point of breaking into sweat. So even if you do for 10 to 12 minutes, you have to do it to the point that you're sweating. At the point that you're sweating, your body is releasing endorphin in your bloodstream. That's really good. So people don't understand, oh, it is stretching, it is, something and all that. No, there's a chemical influence of these things, and that is why it is important.
And yoga is definitely not religion-based in that context.
No. I mean, we misunderstand many of these things. Yoga now has gone to the West and they made it into hot yoga, all those fancy things as a thing, but it is far more than that. It's a way of life. It's a way of life. Yeah.
Can you talk in detail or elaborate on your success coach and your career for the last 1.5 years as a success coach?
So it's not been a very easy journey, for sure. Okay, so I've had my, kind of thing to say, oh, did I do the right thing and things like that. But I know that this is what I want to do. Okay, and I'm saying that I'm doing the same formula, giving myself 3 years to make it work. And if it works, it's good. Otherwise, I've given it everything that I've got, and it didn't work, That's fine too. Okay, but I'm more or less sure it will work, and the signs of that are now, kind of showing up, because now, I can see the road ahead more clearly. So when I started off, it was more about the people I knew and little random bits of kind of thing, and I was also creating different types of, solutions that will work and things. So now I think I'm at a point where I know what I want to do, what will work. I've experimented enough, tested it. So now I know, so clarity. I think that was one piece which was missing in the initial days. Now clarity has come. I now follow up clarity with the right strategies. So then, because without clarity, where to invest in? What do I push? What do I sell? Who do I talk to? And all of that is very confusing. Now with clarity, now I know what my strategy is. Now I know that in LinkedIn I need to do a few things. I need to talk to people. This is how I kind of project myself and so on. So with clarity, I'm able to now propagate my kind of solutions much better. And with that clarity and the propagation, now the traction is picking up as a. And my, I think, model is I want it to be multi-pronged. And so I'm focusing on speaking, coaching, training and teaching and writing. So, different, and it gives me different accesses, it's a different, kind of thing. And of course, I've written my book, Happiness Habits as well. So that also kind of generates some income.
So can you also talk about what is happiness coach and what do you do in that area?
It's a big domain. So the question is that, what is your definition of happiness? That's the first question I ask people. And people will say something vague. Right? And the problem is, the first is that people don't have a standard definition of happiness. Okay, which is, I feel, a problem, because if that's what you're looking for in life and you don't know what you're looking for, how will you get there?
Yes,
right?
People say that I've got chocolate, so I'm happy.
Yeah, and that is the pursuit of pleasure. Now, pleasure is in the spectrum of happiness, but it is not happiness. Because the same chemicals that work for happiness work for pleasure also, but they have, in pleasure, you go up and down like a sugar rush. So when you go down, you can't stay there, so you want to go up again. So then you're constantly chasing. You're constantly chasing food, entertainment, sex, anything that will kind of get you out of the down. But then this up and down keeps you stuck, and you're not going to get out of that because you're thinking that this is what it is. But that is where the element of your habits and all that comes in. What they do is they actually manage the same chemicals, but at a far more, stable way. They don't take it up like pleasure, but it goes up slightly. Over a period of time, the benchmark is higher. So then your triggers are lesser. What would irritate me doesn't irritate me. What would, kind of think, my thought process is much better, my tolerance is better, and my positivity is better. So that is how the element of, kind of happiness. Now, what is happiness? Just as a thing, it's a much bigger dimension. There are two large elements that I want people to understand. One is that happiness is about being a successful person in all the important dimensions of your life, which is your career, your money, your relationships, your health, your parenting, your spiritual, your hobbies. All of them have to work to a reasonable extent. Otherwise, examples like Rakesh about 40,000 crores. What is the point of a life where you have so much money but you're not living a full life, right? Same thing that, and today, so many people, have relationship issues and problems. Right? So first is you have to look at the dimension of life more holistically, make sure all dimensions are balanced. Second is that two things. One is I should always be doing the things that I'm very good at. I must enjoy what I'm doing because every day matters in your journey of happiness. So you can't say I will become happy at 60. Enough old people to know that happiness doesn't literally land on you when you're old. You just think so, it doesn't happen, right? So today is the day for you to be happy. How do you do it? By doing what you're good at. The last element is always pursue being a good human. Have the right values, have the right virtues. That is our journey. And that and we know that all of us have shades of grey. We have in our thought process enough things going on over there. When you become a good human, it's not only about doing, but internally, even your thoughts change. That is the thing. My benchmark at some point that I want to become is when I can, my thoughts can be out there and I can really say what I'm thinking as it is without filters. Then I can work.
Sriram, you explained it very well. But my next question to you is why youngster may understand what you have said. But youngster will question Sriram saying, I have a lot of aspirations. Aspirations means a lot of burning as well, or burnt out as well. So how does one balance that?
Okay. So first is to understand that happiness is multidimensional. I should do what I love. All of that is very important. So for me, I'll tell you what happened with me, right? So, and I know that, initially you're chasing in the Maslow's hierarchy also, you want security, you want entertainment, you want money, all of that. But what happens at some point of time, now it's happening faster because people are earning more money, that you get all that security and comfort very soon. What happens next? And for me, it actually took an episode of almost having a heart attack to change my whole dimension. I was about 40, when my younger daughter was just a month old. I thought I might die. And that was the turning point of my life, where I realized that, okay, but I'm not happy. Right? Okay, something is wrong. I'm empty on the inside. Everybody thinks that I have everything that I'm supposed to be, but I'm not happy. That point I decided to change. Okay? But so it takes a little bit of time. I think people have to go through their hormonal cycle of enjoying and going after things in life. But it will come. At your mid-30s, it's likely to hit you that I have the comforts. I'm not finding meaning. I'm not finding purpose. I'm not enjoying what I'm doing. And then all of these things come back in full flow. And then that's when the earlier you start pursuing, at least follow what you're good at. Because that itself takes care of a large part of, your eventual happiness.
I will just add to what Sriram mentioned is, one is being happy, second is being content in what you're doing. While you can have aspirations and aspirations one should have, but you should also be content in what you're doing. You want to grow, fantastic, but growth will be progressive. It cannot happen as a 2 minutes noodles.
In fact, I just want to, sorry to interrupt you, but I have this term called contented aliveness as one of my definitions of happiness. People say, tell me what, don't give me stories, just tell me in 2 words, right? I would say contented and aliveness. Contented is to know that, we are all, in a way, we must be grateful for what we have. We have perhaps more than what is needed. Yes, you can get more, but learn to be happy with what you have. Doesn't mean that you don't aspire for more, but just be happy with what you have. That will give you the ability to be alive to the opportunity.
So, I will also add that you constantly have to upskill and reskill. Young students have the stigma of saying, I want to grow, but I don't want to learn. What will you tell them?
Growth is part of the core needs of your life.
Of any being.
Without growth, there is no meaning. So let's get out of the illusion saying, I'm not willing to learn and grow. Because even whether you want to choose it or not, life is always trying to teach you something. In its own way. Right? We just don't understand it as a learning. But life is always teaching us. It is necessary to be open. To be willing to kind of grow. And there will be times when you have less growth, you have less learning. There will be times when you have more of it and steeper curves and so on. But then you cannot eliminate that and say, I've arrived. There is no arrival over here. Okay, there is a journey and there are different stops in that journey and we continue to go. And as if you do enough in your life, I think people are always changing. I shifted from marketing to, to do a job in marketing to then recruitment to then different HR and from there now to, kind of coaching and happiness and so on. So there is always, things which are going to shift. So the whole idea that no, this is it and this is all, I can be is just an illusion.
You've also written a book. Can you talk us through your book? What is the title and what is the content of the book?
Yeah. So a little bit of that I covered earlier. The book is called Happiness Habits and it originated from the instance where I had that episode of almost having a heart attack, and then for the next 8 years or so, I was just learning. I was learning, growing, trying to understand the meaning of life, happiness, and so on. So I followed coaching, gurus, religious, modern kind of philosophy and so on, until I came to a framework which I feel worked for me. So then I thought this framework is something I have to offer to people like me. So it doesn't really work for the people who are like a laborer kind of a mindset, because they're still chasing the basics of life. But this is very, very, kind of relevant for people who are, worked in the corporate for about 3 years. Then it kind of settles. What I talk of there is that first start with finding what you're going to do, purpose. Second is how do I become better? Third is fix your emotional mastery as a thing. Then, learn how to be in flow. There are elements of productivity, peak performance, which you need to learn and, kind of practice on a regular basis. Then bring in the element of balance in different dimensions of life. Then it's about mindfulness. And I also talk a lot about in that thing about healing, because that's not something which people often discuss, but healing is very important when we want to be born. Like we hold on to so many grudges. How do I forgive? How do I become more grateful? How do I, kind of learn to elevate my mood? And healing is an important aspect of letting go of our emotional baggage to really think. So those are the 7, I call it the 7 quests. So it starts with the mindset and the 7 quests, and then I have a framework of implementing it through habits. So that's the final, kind of thing. Saying that all this is fine, but now you go do something. And how will you do? Do it by fixing your habits on a daily basis.
You may have touched on this point, but I will reiterate. Anybody, it could happen to you and me as well. More so with the youngsters. If there is a financial problem, or a health problem, or a tragedy at home, we always constantly say, "Why me?" So, what is that he should not do, and he should not ask God, "Why me?" And how can he pull himself up or elevate himself?
Okay, that is a big answer. Okay, now if I start that answer, I think that will just take all the time, and it goes into a lot of spiritual wisdom as well.
I think briefly.
Briefly, okay. See, what happens to you is not in your control, right? The moment you are going to sit and blame, why did this happen, right? Now that is not going to give you any movement. It's not going to keep you stuck. Because when you say, this happened to me, I put the blame there, and what happens with blame is there is no responsibility for me to do it. It's beautifully kind of passed on to say, you did something bad, God did this, circumstances did that, oh, why is my luck so bad? Everybody, there is no human being who does not go through difficulties in life. The richest person to the poorest person, everybody has a cycle of outcome. Now, some people have it easier, some people lesser as a thing, but everybody goes through it. There is no concept of, kind of saying that it doesn't happen to you, right? It is about ownership. It's about ownership. There are reasons why certain things happen. All of them are rooted in you learning something. For example, this concept of how will I learn to be a more forgiving person if I am not exposed to a situation which needs forgiveness, right? That is a duality idea, which says that you learn from an instance which happens to you, and then is when you evolve. For that evolution to happen, something had to happen to you. Now, without that happening to you, how will I become grateful? How will I become forgiving? How will I, kind of evolve? So, but then somebody did that, right? So, if you keep blaming, say, oh, but what can I do? Anything that happens to you, always focus on, is there something that I can learn from this and do something? When you always redirect it into your own ownership, saying, okay, this thing happened to me, this bad thing happened, can I now take something from that?
Introspect is what you say.
And take action. Not only introspect. Introspect is to give you a shift in mindset. But with that mindset, now you should take action.
Right. We spoke about risk, but what was the risk that you took moving from the corporate sector, being head of the department in TE Shaw, and then starting your career? May not have started your career, may not have started being a success coach in terms of finance from scratch, but it had taken a huge shift. What happened? Can you tell us?
See, I've been planning it for a while. Actually, not planning it, but thinking about it. So it's been in my thing. So I've been telling people, saying, this is what I want to do. It's not a hidden thing. So my team knew, my management, everybody knew that somewhere at some point, kind of thing. And, I kept postponing it because this whole risk business is real, right? When you want to really do it, there's always apprehension and there's nothing. Then COVID came, that kind of thing. I wrote my book, that kind of thing. Once the book went out and I saw, decent response to it, that gave me confidence that, okay, I'm willing to now, actually try it. And so I was very clear that there is risk. There is a, kind of element of it may work, may not work. And I said 3 years. If 3 years all in, do it, works, good, doesn't work, I'm willing to go back and, get into corporate. It's not that my skills are going to go away. Somebody will give me a job. I'm good at what I did. That's why, I got here. So, that's not a problem as a thing. I was willing to do it. If I have to relocate, I'll do it. All of that I'm kind of as a thing. So, and for me now, I have younger kids. Okay. I have EMIs to pay. So, it was also that I was not doing this as a retirement thing. I'm doing it as something which I'm passionate about, but it's also my livelihood. And hence I have to make it work at a scale which justifies my decision. So what I'm trying to build is equivalent or even higher than what I was, kind of earning earlier. And hence that is driving to say I will not now say, because sometimes you get in the comfort to say, okay, why should I go and sell to this person? Why should I send this email out? Because I don't feel good about it. Can I just stop doing it? Now I don't have a choice. Okay, because I've got one of the bridges. Okay, I need, to go forward. There's no really going back. I mean, there is an option of going back, but I want to use that only when I have gone far enough, tested it, and said, okay, it works, doesn't work as a thing. So I did my research, I did my kind of thing, and still there was struggle. Still there was, enough things to doubt as a thing. So it took it, slowly, I think the momentum is picked up. And now it's like, in a much better shape.
Especially when you have young kids who are still in school, then you have to put them in college, etc. That's even bigger financial drain, I would say. What is your plan for the future, for the next 5 years? What are the things that you plan to do?
So right now I'm focusing on corporate. Okay, my thing is that I want to propagate happier workplaces. First, happier workplaces means teach the individual to be happy, teach teams to be happier, teach leaders, and make the culture happier. Big pieces. Okay, so very ambitious on its own, but everybody needs it. It's just that they have to, kind of be willing to do the work for it. It's not rocket science, but it needs work. And and it's slightly different from how it's been done in the corporate, because corporate doesn't talk about happiness, they talk about engagement, things like that. But emotions are the most under-tapped thing. If you want somebody to go and fight in a war, you can't use logic, you use emotion. That is the most powerful driver for human beings. Corporates are not tapping into it. So that is one of my things. They tap into emotional feelings. So you want happiness, that's key. That's missing. Right? So that's one piece. Second piece from there is to move into retail, which is that teach people how to be happier in the context of the life. And my whole idea is from sleep to sleep. Is your opportunity in that? How can I fix my life? That's my eventual goal, to take that to a scale where you can propagate something which is practical and doable, but at a scale where people are, where it's flexible and doable to the extent they can.
Apart from your coaching abilities, capabilities, what else do you plan to do? What are your interests?
I'm all in this. Speaking, teaching, coaching, writing. It's a big spectrum on its own, because slightly different skills again, as thing itself is like thing. For me, it is audios and books are the kind of things that I am kind of thing. One really thing that I'm keen is to bring ancient wisdom and stories in the element of what I'm doing to Because you become too left brain, too logical. But emotion tapping is creativity, is through stories, right? But we need to alternate. To go too much over there, people say it's fluff, okay, nothing, right? You go too much logical, there's no inspiration, there's no motivation. I understand, but I'm not doing it. So how to do this? And there's so much ancient wisdom which needs to be used.
You're so right. I'm glad you spoke about this, because our Puranas, our Vedas, I hate to call Ramayana and Mahabharata as mythology. Our history of Ramayana and Mahabharata has got so many nuances, so many small stories which teaches you even your day-to-day life. It can change you dramatically. So the point that you mentioned, our ancient history and culture, has given us lots of inputs. Do you want to speak on that as well?
See, I think what we forgot is that we've stuck to rituals and practices.
I don't like to use the word ritual. I like to use the word ceremonies.
Yeah, but even in all of that, right, what got missed is, and why people are not doing it right now is, they're questioning it and they're not getting the right answers. But there is deep science on the why it is you are being asked to do it. There is such deep science. But our traditional Western science has not evolved to understand quantum mechanics, energies, there are so many. We have 7 layers of body. And all of this is documented and, kind of so many thousands of years ago. Still science is validating it. Right? And that is where the gap is. Because there was so much science that explaining all of that to a layman was difficult. So they codified it through pictures, through practices, through rituals, through ceremonies, so that you get the benefit of it. Now what happened with our, history and people trying to take away stuff, now why that needs to be done went off. Only some ceremonies and some things remain. And now people are questioning, because the Western influences, they're saying, why? What is it? What is the thing, right? And people are getting convincing answers. And they're saying, oh, this is all just, no. If you take every year, and even in our system, there are certain things which were done in the context of that environment, which may not work now, and that maybe should not really continue.
No, but in a larger context, Sriram, I will agree with you that every small aspect, even like I was just talking to somebody, even the rangoli that we put down south, we used to use rice flour. Why was it used? Because the insects will not come inside the house. So there was huge science. It was all scientific and extremely logical. So for the youngsters to fashionably say that I don't believe in culture, Indian culture and tradition, but I will go, understand or agree with what the Western culture, I'm so sorry. Please go back to your roots.
Yeah, no, and not only the rice flour, right? That you first disinfect the whole place.
With cow dung,
which had antiseptic properties. Yes. And they would just do it. Nobody understood antiseptic, this, that, and all. They would just do it as a practice, saying that it's good for the place as a thing. And now, not only the rice flour, it's also the shape of what you're doing has an impact on how, because the brain thinks in pictures.
True.
So there is so much science in that one thing that you're doing.
One small rangoli.
Yeah. And this is what is missing, right? People don't understand that, that your mandalas, all of them, all shapes have a certain impact on your mind. That is one reason. Then there is a practical reason of that. Of course, it looks good. Then there is a reason of, using rice flour. Then there is, disinfecting the place. So much is there.
And not just the rangoli, but the stories of Ramayana Mahabharata has got so many nuances. So I would strongly, through this podcast, would strongly advise and suggest to all the youngsters, go back to your roots. There's enough material on Google. Please read it. What else do you wish to do in your life, apart from being a success coach?
My life purpose is to try and transform lives of other people using my skills to the best that I can. And those skills I feel are in the space of speaking, teaching, coaching. Right? That's what my ultimate intention is, to be able to really impact lives of people because I've done so much work. It is the money I've spent, the time I've spent. I don't think people will have that much energy to do it. Now, I want to be able to offer that to people like me. Okay, I'm not claiming that I know everything, but I've certainly invested a large part of my life in learning. And if I can translate that into pieces which people can then quickly pick up and just use it, right? They don't have to spend the 8-10 years of study that I've kind of done. So not only the 8-10 years, even before that I've anyway studied. It's just that it kind of accelerated as a thing. But the idea is that let's make our lives more pleasant. We have everything. This is the time in the whole history of mankind where there is so much comfort and so less happiness.
The last couple of questions is, what are the things of the podcast that we have spoken for the last few minutes, as what is the 3 salient points or 3 important points that you would advise young students and young professionals?
First is
in terms of both their career and their mental wellness.
First is enjoy life. Okay, life is precious, but it's also meant to be lived fully and enjoyed, and all experiences add up. So don't look at experiences as good, bad, success, failure, but just as experiences, because the failure then makes you enjoy the success. That is how duality is, that is how life is, day and night, all of that is like that. So life is a journey, life is an experience. Just take it as an experience. Okay, don't get too caught up in expectations and so on. Second is, kind of do the work that's needed. Yeah, I'm not saying that you have to do hard work and things like that, but I'm saying that work is required. That you have to do it.
What you mean is get your hands dirty.
Get your hands dirty. Become the expert. Do what it takes to really go down. Because a lot of things I find, people are on the surface and then they claim to be experts. They've not really done the work.
They've not done it.
Okay, without that, it is not possible for you to create great value. Do the work. As a third is always follow what you're passionate about. That is the most important fact. For that, first you have to discover what you're good at, and that I've seen even when I'm coaching very, very senior people. They say, I don't know what my purpose is. I don't know what I'm good at. But they are good at something. That is what brought them here. But it's just to decipher that, pull it out, and do more of it.
My last question is, you mentioned networking. Young professionals should network. How does a student build his network?
See, first is that treat every conversation as an opportunity to connect. First is to listen actively.
And also meet people.
And meet and connect. And forge a genuine connection. Because if people think that you're just connecting with them with the need to sell them something, they're going to run away. Right? So it is not that. It is to have genuine, interesting connections. When you do that, eventually that connection then grows. But that only comes from the fact that I care about you. I want to know about you. I want to, kind of be the recipient of listening to what you have to offer. Then connections form. As you have more connections, from these connections, there will be people who can point you to other connections, people who can buy what you are selling, people who can direct you. And people who can value add. You can do service to them. It is always a give and take. It is never just taking, never just giving. Always give and take. And if you go into that mindset of genuine interest and then connect with as many people as you can, that's the.
I will add to what Sriram mentioned is, as a student who's just in their college, you can build your network through your seniors, your lecturers, your visiting professors. You will get into doing internship, build your network there, and gradually it will grow. It was wonderful talking to you, Sriram, and thank you for being a guest today. We wish you all the best for your career, and thank you so much.
Thank you. Thank you. Appreciate your time. Wonderful having you.
Thank you.
To stay informed about the startup ecosystem, subscribe to my Startup TV.
Namaste, I'm Srilata Shankar in collaboration with My Startup TV. In our Leadership Talk series, today we have Ramesh Swaminathan. Ramesh Swaminathan works as Vice President, Products at Real Page. We welcome Ramesh Swaminathan to our Leadership Talk series in collaboration with My Startup TV. Good evening, Ramesh. Welcome to our Leadership Talk series.
Good evening. Thank you, and thanks for giving me an opportunity to talk to you and chat about my professional career.
It's wonderful to have you, Ramesh, with us. Let's start from your graduation. I understand you have moved into different areas and different designation as you've grown in the career, and now working with management. So we will understand your journey. Can you please explain or tell us right from your graduation and what took you to product management?
When I started getting into college, I never knew a profession called product management existed.
Exactly.
I wanted to do business administration, and I did a bachelor's in business administration from Chennai. It was from the Madras University, and I to be fair, I when I finished my class 12, I wanted to do hotel management.
Mm,
I was like a big fan of cooking and making a lot of
wonderful.
exotic food, right? And I wanted to do hotel management. And we're talking about hotel management like this is like 28, 30 years ago, right? And there were a few institutes, very few institutes doing that. And there was this Indian Institute of Hotel Management in Bangalore.
Mm.
And I did not realize that at that point in time, getting into that course was as difficult as getting into IITs,
And it,
right?
yeah.
So there was an entrance exam. I qualified for the entrance exam. Then they had some
Interview.
kind of a group discussion and stuff, but I didn't get through, right? So my secondary was to get into okay, I wanted to get into sales, right? So then I looked out and said, okay, let's do. At that time, bachelor's in business administration was pretty
Was
new.
the thing, yeah.
Yeah, and so I thought I'll get in there and started doing that, right? So that's how my career started. I did business administration and I finished that, um, and then once I finished that, looking for jobs, my my dad moved to Hyderabad. This was in Chennai, and my dad moved to
Sure.
Hyderabad, and I moved to Hyderabad, and then got into an FMCG company, right, doing sales coordination. That's how I started my career.
Once you started your career in sales, what are the challenges that you faced in sales? And what kind of sales did you do? And when you were, did you do consumer goods or any other aspect?
Because I started out in consumer goods. I was selling paper, right? I worked for a paper manufacturing company. My job was not a direct to consumer selling, it was more of selling to agents who used to buy paper from us, right?
Sure.
So I did the job for a year, and that was a very interesting kind of a learning for me because that market at that point in time was very manufacturer centric and not
Sure.
really consumer centric, right?
So which was this
Because
company, Ramesh?
this company called AP Paper Mills,
Right.
they're based out of the factory was in Rajahmundry, but their head office was in Secunderabad at that point in time. So
This was near ITC office,
correct,
right?
absolutely.
Small world.
Yeah, absolutely correct. Right. So my job was to sell paper. My job was to we had like agents, paper selling, agents across India, like 75 registered agents. And my job was to collect orders from them on a day-to-day basis, right? And because at that time, because of the way that market was,
Hmm.
paper was manufactured to order. It was not
Hmm.
manufactured and then sold. It was
So
like manufactured to order. So you'll have to collect orders from agents, then send it to the factory to be manufactured. It will take about 30 days for manufacturing and then it will be delivered. So that's how I started my job. I thought it was an interesting job because for somebody who was just out of college, it was very um, uh, high activity, lot of action happening. Was learning a lot, working with like agents across the country, first time exposure to a lot of people. Uh, that effectively means a lot of behavior,
management, yeah. People management.
patterns, which is very different. Talking to somebody in Delhi is different from talking to somebody in Calcutta, which is different to talking to somebody in Tamil Nadu, right? So being able to somebody who has not got out of South India, that was a big cultural change for me. The way people were behaving, the way people were, uh, you know,
Interacting also.
communicating with me, and my job was to be on the phone every day, right, to
Yeah.
speak to those guys, and but I felt that actually helped me very well because uh, I thought I was an introvert before that, but that actually helped me to get out of it, get into that comfort zone where I can talk to anybody in whatever language, right? So I think that was learning for me.
So the Ramesh Swaminathan that I know, who's telling me that he was an introvert, is completely no for me today.
Yeah, yeah, yeah. It's not. It was me 28 years ago.
Right. So, what were the challenges that you faced, and how did you overcome it in the job that you just spoke about?
My first biggest challenge was communication, being able to communicate and get orders from them, right? That was one big challenge. Somebody who's just out of college, and these guys are not small guys. These guys are all big paper agents, big paper merchants. Uh, they were doing
They were
multi
keeping their own
multi
business.
multi 100 crore businesses at that
Right.
point in time,
Right.
right? I mean, yeah, they were sort of those old world business dons who were actually running those businesses, given the nature of given the nature of that industry, right? But then that's how things worked, and for me that was a challenge. And the second challenge was um, I had sort of uh, um, you know, strict rules on what kind of orders to take, right?
Mm,
So there was complexity in terms of, because if you see paper is not paper, right? There are like multiple varieties of paper that you can build,
sure.
right? And when I'm taking orders from agents, I had to take orders from agent in a specific variety of paper for a given week, because the machines once there were like quite a few machines, and a machine once manufactured paper, it had to manufacture paper in that specific variety only. So I had to take orders in that specific variety. Being able to convince a dealer that he had to consume paper of that variety that week was a challenge, right?
And
So
how did you overcome such challenges and many more challenges?
um, I would say that I was lucky enough to have a great mentor. I was
Sure.
lucky enough to have a great manager who used to actually work with me, teach me on how to work with these complexities,
Sure.
and complexities, I would say, right? Of working with people to understand their needs, being able to work with them. Both parties can empathize with each other and and get to a win-win situation. So I think that actually helped me a lot.
AP paper mill, paper company. What took you to a next job?
So early days of IT in Hyderabad, when there were quite a few startups that came up at that point, and some successful, some not so successful. But then there was this startup company that was looking for salespeople. They were trying to sell some software product for Hyderabad-based industries, and they needed somebody who can come in and do software sales. And that's what I got. I mean, after working for a couple of years with an FMCG company, I got into an IT sales position. And I didn't know at that point in time that would be a turning point for me in my career. I didn't know much about IT, right? Once I joined that company, I actually went in and started learning IT. As I was working there, I did a course to learn software and technology and stuff like that but my job was selling. I never was a technocrat, I would say, or a geeky kind of a guy. I was more of a sales guy, right? This company did pretty well at that point in time, I would say, and I did pretty well in the company. It was early days of IT, so I still remember me and my friend would actually go in a Bajaj Chetak. carrying carrying a physical server,
Right.
right, to actually demo software products to folks. Because laptops were like unknown of, and even if it was known, it was very expensive for a startup company to afford a laptop at that point in time.
Sure, sure.
So
It's only
but
the
that
senior management who had, when I say senior management, is probably the CEO and vice president who
correct,
had a
absolutely,
laptop.
right, right. So we used to literally carry the machine in. We used to take a Chetak because Chetak had that space in the front to hold
You're
those.
actually advertising Chetak. No.
Right? I mean, it helped us because we had to go all over the place, all over the city, trying to sell software, and that was interesting too. There were challenges there, a lot of challenges there, but then that was also interesting. It was those were days that my career was getting made. I was building my
Sure.
character, my knowledge, right, on how I can do the stuff. One is I was learning technology on the side. I was selling technology to folks, and that was interesting.
To stay informed about the startup ecosystem, subscribe to my Startup TV.
Namaste, this is Srilata Shankar. In our Leadership Talk series, in collaboration with My Startup TV, we today have Veena Yeleshwarapu with us. She is into product management, project management, and many more things. Let us understand her journey. Welcome to our series, Veena. We are pleased to have you with us as a guest today.
Thank you, Srilata, for having me here.
What you did in your graduation and what took you to the journey that you are now.
I did my graduation from Bharati Vidya Bhavans. I did my BSc Electronics, and it was in 1994 when I started my BSc Electronics. And that time my idea was to join ECIL. All my uncles and my aunts were all in ECIL, which is close to my place where I stay. So that was the reason I took electronics as my elective. But then after a few years I realized, okay, this is not my cup of tea, and I want to do something which is in boom, right, in the industry. So then I took help of my friends and also my dad, who was also educated during that time of his journey. He did his MA as well, and he suggested that I should go for master in computer applications. So I finished my electronics with lot of pain, I would say, but I took up MCA, and obviously into IT industry. And
Where
when
did you
I
finish
came
your
out,
MCA?
I did it in I completed in Y2K 2000 as a MCA graduate, postgraduate.
Where did you do your MCA from?
I did my MCA from Osmania University, but the rank which I got was kind of, at that time we didn't have many colleges. So there were hardly like 15 or 20 colleges. I got my seat in Nizamabad. I did my MCA from Nizamabad, but it was affiliated to Osmania University as well. So I completed it in the year 2000.
Okay.
And then
So after your MCA, where did you start working, and how did you continue your work?
So that was like the time where we didn't have much of web and networking as such. We used to have the hard copies of our resumes. We used to drop it in every industry that we used to come across. So there were there were only a few big names that we could hear, Satyam, TCS, and not many. So I think it was my third attempt in the companies, that there were no fresher recruitments, there were no off-campus or campus recruitments as such. So it was like a manual work we used to do. We used to print our resumes, drop them in the drop boxes of these IT companies, and luckily among all my friends, I was one of the first persons to be called for an interview in Metamore.
Okay.
So that was the company which took me in as a fresher. I joined as a junior software engineer.
Okay.
But then unfortunately that was the Y2K time, where all the systems were going down, mainframes were all down and whatnot. There was a lot of boom that IT industry is going to come down, and everybody will be on the roads and things like that. But I never took that seriously. I said, okay, everything happens for a reason. There will be ups and downs in various industries that you talk about. It's not only IT, right?
So as a software engineer, which domain or vertical were you working on?
So I started as a mainframe developer. I started as a junior software engineer. I used to do code. I used to prepare designs and all that. So I am core techie person, I would say. My background is technical. So then I moved over to Java also for some time. Then a lot of designing, support, maintenance,
Right.
and production support. All these things were.
So you must have used COBOL and C++.
Oh yeah.
Right.
COBOL was my first programming language. I really enjoyed it. People say that it's boring and all that, but I had fun. So I mean, it doesn't matter what language you really work on, right? I mean, there's every learning in every aspect of the work that you do. That was my mantra from the beginning.
Absolutely.
I continue with that.
Yeah, and I did my NIT course, and that's how I know COBOL and DBase and all that, which is obsolete now, but except for COBOL, everything else is obsolete. So from a software engineer, what was your journey as from mainframe to Java, and how did you transition as a project manager?
Okay, so initially Metamor actually took a lot of metamorphosis, I would say. We had a lot of transitions happening, different companies took over. It was called Keen. By the time I came out of that company, it was Keen India Limited. I grew up in Metamor as a software engineer, then I moved over to senior software engineer role, where I took some responsibilities for the team. I used to groom a few set of people who were junior software engineers. So I came out as a senior software engineer from Keen India Limited. Then I'm in Accenture. Actually, there was a lot of growth curve. That's where I moved. That was my second company. So from senior software engineer to project management. So it was a long journey, lot of learnings, lot of challenges on the way, but it was all, a very good learning curve, I would say. Lot of learnings, I would say. I mean, project management training as well. We had a great manager. I don't want to take their names.
Sure.
But there was a lot of very good grooming, and the coaching that I received in Accenture is impeccable. That is kind of a, always I cherish the moments that I spent in Accenture, where I grew from senior software to project management. I did my PMP certification as well in Accenture. They sponsored my certification. So that really helped me move into a management role, where there were a good number of reportees at some point of time in Accenture. When I was coming out, due to my health reasons, I had to leave the company, but there were about 100 plus people reporting to me.
Sure.
One full organization, I would say. I mean, it was called a business unit.
Subunit,
yeah. So that business unit was built from scratch along with me and my manager.
Sure.
So I take pride in that.
Most of our audience is management students or engineering students and the young professionals who have just started their career. And when I say young professionals, it could be 0 to 8 years experience. For these people, what is the transition, or how does one get into a different role similar to you, who started with mainframes, then moved to Java, and then moved to project management? How does one seamlessly get into it, or what are the steps that he or she should take to get into project management?
Transition is just an attitude, I would say. I mean, if you have the right attitude of doing something, you have the passion, you can move into any career, I would say, irrespective of the industry. It's just that you should be passionate about it, and maybe you do some initial groundwork of learning, right? You train yourself, or you join a course outside. That will really help you groom your skills, and then you can definitely, if I am now doing project management, nobody can say that I can move over to some product management, or I can do coding. I cannot do coding. I mean, it's nothing like that. It's all in your attitude and everything. I mean, I would give that advice to even the students who are budding, programmers or getting into management areas. I think it's nothing like you can't do anything. You can do everything. It's just that you'd have the right skill, just build it over time. It doesn't come in a day or two, right? I mean, it's over time. You keep learning and learning, network, have have conversations with your peer groups and understand what is the prime area that you need to focus on, and also your interest, right? What is your interest? You can groom yourself in that.
I'm glad you said that, Veena, because people, tend to get aspired by somebody who's senior or wanting to get into their kind of a role, but not put in enough efforts. I had typical number of examples such as yours, who the youngsters, you would come to an HR person and say that, ma'am, she's into SAP and she's traveling or he's traveling abroad and she's earning so much of money, so I want to get into SAP. So which is a wrong want or desire to move into that, because unless you are wanting to get into that role, wanting to get into that domain or vertical or any other role, doesn't make sense, because money and role should not chase you.
Correct.
Your desire, wish, want should chase you. Very rightly said. What is PMP certification? How does one do a PMP certification? What is the course? What is the role after?
Project management, the basic requirements nowadays that companies ask is the project management certification, that is PMP. It is offered by PMI, Project Management Institute USA. They have like a PMBOK, that is a book of knowledge. They have laid down certain guidelines for a project management to happen, right? It's irrespective of industry. Even if you take a construction industry, there's a process, right? You build the basement, then you go for the walls,
floor,
and then
floor,
the ceiling and all that. So something like that. Project management is irrespective of the industry. Once you do that, you can apply that knowledge in any kind of industry. So it's financial management, it is staff management, right? Resource management. Then you have the schedule management, cost management, right? Then you have reporting, how you manage the stakeholders, how you manage a project end to end, like the maintenance and things like that. So it has laid guidelines of how a project should run right from inception to the implementation. So there are various steps involved. So it is kind of a book of knowledge, which is, you can mug it up actually. If you have to give that exam, it's just mugging up and applying that knowledge in the industry that you work on. And then nowadays it's unfortunate that people are looking for that certification. It's not always that. It comes with a lot of experience as well. So having this certification is definitely a plus, but then there is an experience that is way more than the certification itself. So once you have that knowledge of how a project should be run, how do you set up a team, how do you staff the team, how do you interview, what is people management, how do you deal with people, how do you handle situations, right, where people get into conflicts, what is conflict management, what is risk management, all these aspects in a nutshell is called project management. So that is what this certification is about, and it takes about 3 or 4 months of preparation. At least for me it took that. I mean, you have to look into various aspects, because I had a little background of managing a project as well, and a team. You will get to know these with experience. So with definitely little amount of knowledge of how to run a project plus studying, you can clear this exam. It's not easy. It's an online exam. You have to go to a Prometric center, give that exam, and then it's very tough, I would say. I mean, even if you have an experience with project management, you will have to, there are situational questions which are difficult to interpret as well. So you have to really focus for those 3 or 4 months, and then I think you can definitely clear it. It's not a rocket science, I would say.
Sure. So how does one apply to this PMP course?
So I think once you go through the books that are preferred, I think there's Rita Mulkey, there's a PMBOK book which is written by her. There are mock exams that you can give. You can apply it in PMI, Project Management Institute USA, on the website, and there's some fee that you have to pay, and you can
I
give
think
the
it's
exam.
about 35 or 40,000.
Initially, and then you renew it every 3-4 years.
Sure.
So with the current knowledge that you have built in, if there's a team management that you have done, you add some PDUs, professional development units. You keep adding them year on year, and every 3 years you got to renew those PDUs.
Sure. So what one always believes or one understands, is project management is specifically only for the IT people. So I'm glad you said that it can be used across industries, across verticals, across domains, etc. Even an HR person or finance person can use project management, and he or she can do the course as well. So you also mentioned it is people management, it is dealing with people management, how one organizes the entire fulcrum of HR. How does one do that as an HR person? Let's say I am wanting to do an PMP course, I am the HR leader. How does it benefit HR department or a finance department?
Definitely. So you can take the particular assignment that is given to you as a project itself. How do you start that? Suppose you are a HR person, you are given a task of recruiting some n number of people by 3 months or 4 months. You got to get profiles, you got to interview people, you have to see the fitment, then you touch base with the technical, you have to schedule those interviews. So all these steps are actually, I would say, it's part of project management. What is the first step? You lay out a plan. What is my first step? So in that step also I'll have sub steps. How will I have to liaise with some external consultants, or will I get the resumes? How will I get those resumes? So those things are like project management. You define the dates. Unless and until you define dates and work upon, like, so I have 3 months, you have to work backwards. By the end of, suppose this is June, right? By end of August I need people. So you work backwards. August 30th I need my people here. So what should I do? Just work backwards and get things done. It's a project for you, right? Even if it's a HR or finance team, for example. So finance team is probably introducing some new tax component into all the salaries that are being credited to employees. So how do they do that? It's not a simple task, right? How do they introduce that? Where should they introduce that? Whether it's basic or flexi or things like that. So that itself is a project. So by which month they are supposed to credit. It can't be March. So so that's how they will have a project by itself. I mean, every industry, you name it, construction, Embark itself says that, the book which I am talking about, which is referred to for all the PMP certifications, that itself says that there is no industry that you cannot apply the project management.
So it doesn't necessarily have to be a mammoth project, it can be a tiny project as well.
Tiny project, yeah.
Right. What is the difference between project management, program management and product management?
So project management is a subset of program management. A program is like a group of projects. Like suppose I have a huge project under which there are multiple projects A, B, C which have to be executed in parallel. Different dates, different go live dates, different start dates. But then I actually am sitting on top of, suppose the management is here, and then they are having multiple project managers under them. They will assign the projects to them, but at the program level they will have to monitor that all these projects are running smoothly and they are delivered as per the timelines. For them it's a program, because it comes, suppose it's a health or pharma industry under which they are operating different projects, and they are launching a product for a particular division, and that division comes under their purview.
Right.
So that means that is a program for them. So I have to launch this product for X, A, B, C companies, and then I have to introduce this into the programs that are running for them. So that is a program. So program is a it's like a group of projects which are being executed at various levels. That is program. Product, as you understand, I mean, it's like a tool or a product. I mean, how should I say that? It's a software. As suppose the product, how can I give you an example?
Product that is being manufactured has to be sold out.
Yeah, you can take that as an example when it comes to the product industry, but when it comes to project management in the IT side, I would say there is some kind of an application which is being developed by a company. Suppose I am a company, I am trying to provide some kind of a package to a pharma industry or any industry for that matter. I am developing a full solution for them. So that is a product. I give that product to the company which I want to liaise with, and then I will give them this product saying that this will serve the purpose of so and so with your organization. Sometimes there might be some edits to that, right?
Sure.
It might not work as I have developed for my company. So X company might use it as is, but Y company might say, okay, it doesn't work for me as is. I need a lot of edits to this. Okay, it has to suit the compliance related things in my company. So you have to tweak that product accordingly so that the company, second company can use.
Correlation with marketing, compliance,
Exactly,
solutions,
lot
etc.
of things actually. So product as a solution is nowadays buzzword, I would say. So product as a solution, SaaS products, you might have heard, software as solution.
Yeah.
So product as a solution, platform as a solution, all these are like products which are owned by a company.
Sure.
And then they customize that according to the needs of the organizations that they are serving.
Sure.
And then that is the product management. So I manage this product from my perspective.
So till now I understood product as selling a particular product,
package, anything.
It could be a talcum powder, it could be for an IT company, it could be some package.
Yes.
But now what you've told us is it can be solutions for that you're delivering for the outside market. For a student who's got into Java or .NET, for a student who's joined company and moved into Microsoft technologies, Java, .NET, how does one become a project management or product management? What is the career?
So I think it depends on their choice. Nowadays companies are offering different kinds of choices. They can choose their path. Either they can go technically, they can build their knowledge technically, they can be technical experts. They can do architect, solution architect and all that, right? You can go to up to that level. Some people are passionate about people, people management, dealing with people, having people around makes them happy. So somebody like
team
me,
management,
right? I love to be with people, I love to interact with new people, learn from them, it's mutual.
Right.
A project manager is not somebody who's, dictating terms to the team. I don't believe in that. There's a lot of learning back and forth. The team thinks that okay, they are my boss and all. I don't believe in that concept at all. Like you have more experience than them. That is the only difference that your team and you have. So some people are passionate about that. Then they can go into project management where it deals with people. People aspect is a major core of project management. If you don't treat your team properly, you're not a good project manager at all. I mean, you can't deliver what you promise unless you have a good team in place, and team rapport can be built with a good project management skills. How you deal with conflicts, how are the risks handled. If a team member comes to me and says that okay, I'm having this situation right now, how do I deal? Whether it's technical, you diagnose that situation, right? It's technical, non-technical, or it's with people themselves, they are having conflicts. How do you resolve that? You sit with them, have remand kind of a thing where you understand what the situation, how that situation occurred and things like that.
So my question is, you as a project manager, are you dealing with teams who are working on different Microsoft technologies or verticals? Like for example, one person is working in SAP, one was working in Java, .NET. Do you manage this entire team or how's it?
So it's a mix of people. It's a matrix organization that I currently I'm working on. I mean, in Accenture it was a different situation where we belong to that hierarchical model where people, they were different technologies there also, here also, but this is a matrix where they don't report into me, but we come together as a team when we execute a project in my current organization. Whereas in Accenture it was like my team who were distributed across various domains, technologies. Again, they were reporting to me there. I mean, the kind of organization, I'm currently working in a GCC, Global Capability Center, which is kind of a captive, right, the previous term of this. Accenture is consulting services where you have that hierarchical model and things like that.
Not in the question of hierarchy, but my more relevant question was various technologies that one is working on. I could be a Java person, my friend can be working in SAP. They all kind of merge into project management.
They can, it's technology aversive, I would say. I mean, there's no particular technology that will lead you to project management. Whatever technology you're working on, if you are like passionate about leading a team, being a project manager, you can go from any technology and come to this area.
All right.
Right?
So even a person with ERP background can get into project management.
Course.
Right.
Yes.
So, Veena, today's youngsters, whether it's college students or young professionals, they have a lot of exposure compared to you and me. If you remember, I am sure you're smiling already. We had to go to an internet center, wait there for 20 minutes to get a half an hour slot, and we did whatever we could then. Today, everybody has a laptop at home, maybe probably 2-3 laptops at home, and everything is on a click of a button. Today's youngsters are very smart, very passionate. I wouldn't say very passionate, but to an extent passionate. But they also are very restless. They want to keep jumping jobs. I as an HR person, I keep telling them this stability is the most important thing. So what are the 3 important things that you would tell the youngsters and students today for their career?
I would say be abreast with the current technologies. I think you have to keep honing your skills. It's not that you stop at one and say that I'm done, right? Every industry is like that. I mean, you can't stop at something you learn and then you say, okay, I'm done. This is going to take care of me for my life.
In fact, learning doesn't stop even at our stage.
Yes, of course. I think you have to keep upgrading your skills, upskilling, right? Every moment.
Upskilling and reskilling.
Right. Too much. I think that's change that you have to accept in today's industry. I mean, today you talk about one technology, tomorrow it's gone, and day after tomorrow there will be new technology coming.
Even 5 months back, we didn't even know what was ChatGPT.
I know. Today people are using, even first grade child is going and typing his project in ChatGPT, and you have everything coming up, right? So today AI is taking over, cloud technologies are taking over, right?
Machine learning.
Have to machine learning, whatnot. You keep upskilling and reskilling. That is one first and foremost thing that I would say. The second thing is, once you learn a particular technology, build upon that at least for a few years, right? You can't be saying that, okay, I'm done, this is 1 year, this is gone, and things like that. At least build so that you have that groundwork, like base developed, at least So languages are no different, I would say. I mean, even the latest technologies have some language going on in the background, right? Once you learn a language and its basics, those basics will help you learn the other languages as well. Otherwise, if your ground level itself is weak, that means as you go, even if you be a jumping jack, looking for other jobs, this groundwork, if it's not strong, you will not be strong in anything. Build that. I think be with a particular organization, learn all the groups, like what they are doing, be curious, right? What other groups are doing, go keep learning, keep inquiring. Network also is the third thing that I would suggest. Network. Some people are very introverts, and they say, okay, I'll do my work, day job, and then leave. It will not really help you in nowadays. Networking is a first and foremost thing where you should know what other groups are also doing. It's not just your job, right? Nowadays you have to know what the organization's goal is. Otherwise, if tomorrow somebody comes and says the organization is changing and this is what we are introducing, and you are not even aware of what is happening, so you will not be considered for a particular role that they might be looking to fill, right? Unless and until you network, you build that group, right? LinkedIn is a place I would suggest where you go network with people from different industries, your friends, your peer group, and your college, everything, right? It includes the entire set of people that you deal with.
I will add to what Veena just mentioned is every student who was passing out, whether engineering student or MCA student or a management student, I always insist on telling them that at least minimum of 3 years in each company is a must.
Correct.
If you're jumping within 10 months, 11 months is not going to have any growth for you. You may get 5,000 or 10,000 more in a different company. That may be your second job. Third job, no one will even look at you. And I am, as an HR person, I'm authentically telling you about it. Because if somebody, let's say Veena has come to me with 11 months experience, I will ask her a series of questions, not just in terms of technical, but saying why did she leave, what is the reason, etc., etc. So 3 years minimum, otherwise there's no stability. The reason I say about stability is when companies recruit you, they invest a lot of money on you in terms of recruitment, in terms of infrastructure costs, in terms of training. And if a person is going to leave in 11 months time, why will a company invest that kind of money on you? That's point one. Point two, what she mentioned in terms of learning, continuous learning is a must. There is no two ways about it. There's no shortcomings to success. You have to do the grounding. You have to go according to the universe of what is in store for you. You have to be patient. You cannot get it done within 3 months, 6 months. It's not a 2-minute noodle. There is a career path. If you want to reach a vice president's role, as a junior executive to the vice president, it will take you minimum of 22 to 25 years. So you'll have to be patient. Third is, like she said, you have to be like a sponge. You know, what does a sponge do? If you put a sponge in a pool of water, it absorbs. So as a student, you have to learn, absorb. Networking, the third point that you mentioned, was not just in terms of LinkedIn and your seniors, but within your organization seniors, your cousins, your friends, your college seniors, network with them, speak to them constantly. And that's how, like, let's say Veena is your friend, Veena's friend can be your friend as well. May not necessarily you have to hang out with her, but these are all networking for your future career and growth in terms of learning. Thanks for the great inputs that you gave, Veena. What are the things that you will say that a student should not do? 3 things student and young professional should not do which will hamper their career.
You know, some people I have seen in my experience, when somebody from college pass out joins the organization, you know, they get bored very easily with the technology that they are on, right? Irrespective, I was in mainframe, which was like considered as, you know, boring obsolete, technology, obsolete, it's going, why are you even opting for that? It doesn't matter whatever you are put in. Initial part of your career, you have to ensure you build that base, as I said earlier, right? Go learn it. Even if it's old technology, go learn it. I think there's that basic groundwork that you still have to do. You know, every programming language, you know, you define the variables, you define the logic, how you end the program, you introduce various loops and all that. I think it's all common across the board. It's just the language that is different and how you apply it is different, right? So go learn that whatever you are assigned, take it as a challenge, learn it completely, gain experience, you know, use as company is making you, you know, work for them, you have to also take advantage of the company and use that as a ground for you building your base. I think it's all mutual. When you go join a company, it's a mutual win-win situation, right? Company wins from your work, you win from the company's work as well, you build that knowledge. I think without that, I mean, that is one thing that I've seen people, you know, they get bored, they say, okay, I need a different role, or they'll, you know, straight away resign. They will not even spend the initial part of their career, which is like solid 4 or 5 years. You said 3 years, but I would say 4 or 5 years, be with that organization, absolutely. Learn everything that you can, right? There's no job anywhere in the world which doesn't give you learning, I would say. I mean, that was absolutely. My attitude, at least when I joined as a fresher. Learn from every small thing, even if you are given an Excel data entry, right? There will be a lot of macros that you can build, you can make things easy. People who are taking like days together, you can create a macro, right? Learn from it.
Even there's small things like VLOOKUP, HLOOKUP,
correct, learn it. There is a lot of things that you can learn. Don't say that it's boring, right? Automate and see that you can give that as a challenge to yourself, that okay, let me automate this is going to be manual and boring work, I'll make it interesting,
absolutely.
Right? So that thing you'll have to develop. Don't say that it's a trivial job, it's not a great job that I'm doing, right? That is second thing. Third thing that I have seen is, you know, they are not learning nowadays. I mean, with the new technologies, I mean, once you have gained enough knowledge in a particular organization, don't settle for that, keep learning, ping the market and see like what are the current trends, right? ping the market, what are the demand, what are the technologies in demand. Go train yourself, go certify, invest some money. It's okay, you spend that money, you gain, you know, twofold, threefold in future. So invest in your learning, that is definitely. And I think maybe this is the second one. Third one, also give time for yourself. Mobile is not the only world, gadgets are not the only world. Invest in your, you know, spiritual things, which will definitely bring all the kinds of stress that you are going through.
Well said.
Right? Invest in yourself. Go travel, explore the world. I would say, you know, whatever you earn, 50% you can save, 50% you spend on yourself and your family. I think that is something that people are missing. You know, they are sitting in their own confined rooms,
Cubicles
and
and,
cubicles, whatever I would say. I mean, they spend time for, you
Silos they
know,
work
days
on.
together on the internet, but they don't explore what is happening around.
Right,
There are so
right,
many things
right.
that we can explore.
Yeah, she mentioned traveling, but beyond traveling, I would also say that invest in your inner self, understand your inner self. When I say meditation, it doesn't necessarily belong to a particular religion. Meditation, yoga is religion free. Please invest yourself in that. Today, youngsters, as you rightly said, are extremely frustrated, extremely stressed, and people like, not necessarily our generation, please understand that we do not get stressed at all. Why? Because we understand how to manage life. I think that's the next question that I will ask you. People are very frustrated. We youngsters are very stressed out. You know, small things like, okay, the mother doesn't buy them a smartphone, they want to take their lives, they want to commit suicide. If they don't get the bike according to their liking, they commit suicide, which is bizarre, which you and me were never even thought about it. Even today, we understand, we've gone through so many aspects of life, whether it's health, whether it's family, problems are there, and we know how to circumvent them. So what is the one most important thing, or the most important thing, that you would tell the youngsters in terms of stress?
I think they are like over passionate about whatever they do. I think once they are addicted to a particular thing, they are like, you know, let me explore more, let me explore. They just go dig deeper into that. I mean, which is kind of a stressful environment. You travel to work, you are on the road, you don't have patience for the traffic to clear, right? You abuse people on the road and do what not, right? Likewise in the office as well. I mean, if somebody is telling you something, you just give them back in different kinds of languages. I mean, these things have to be curbed a lot, which is like a self retrospection, which is lacking, I see. I mean, just see what you want in life, right? Do things that you love. If you have joined a course, suppose you have joined an IT industry, or you have joined a particular industry, it's your choice, right? You have joined with your interest. Why are you not able to focus on that? So just self retrospect, I would say. And definitely, as you brought the point of spirituality, investing in yourself, that is what I don't see in the current generation. If gymming is something that you love, go spend time in gymming. You know, draw a line for everything that you do. Or work, draw a line. Say, I'm not going to take up any work after this time. There might be situations where you have to compromise, but that's okay. You compromise on that. But draw a line, give yourself time for gymming, yoga, you know, spirituality, involve yourself in, you know, jogs, right? Whatever enthuses you, right?
Work as well.
Yeah, do some social service that really help. Do some volunteering service at various organizations. They offer, you know, it gives a lot of self satisfaction that is missing, I see.
When we are talking of spirituality, it doesn't necessarily have to, I don't mean to say that, you know, one should spend 7 hours, 8 hours in front of a deity, but that inner calming is required. You can either tell a Hanuman Chalis or a Gayatri mantra, or whichever faith you believe in. That calming is very important, and that will lead you to less stress, which will lead you to more success. You know, it's a mantra. Less stress leads to more success.
Correct.
So do not get stressed, do not get, and you must understand, like I told you, it will take, everything has its own time. It took you 10 years to finish your 10th class. You didn't finish it in 1 year. Similarly, to get to a vice president level or a CEO level, it will take you 22 to 25 years. It does not happen overnight. So we've had a wonderful chat till now. What are the things that you like as an individual apart from your work? What are your interests?
Yeah, so I'm into spirituality a lot. I believe in spending time, at least 1 week to 10 days. I detox myself from the current happenings, family, everything. I go alone to I'm a Isha follower. I follow Isha yoga, and I practice yoga as well every day. I spend a lot of time in my inner well-being as well. As you said, I was also in that situation of stress, right? I mean, I was very frustrated. I was screaming at everybody. I was yelling at my kids. People never used to like me before when I was around. I was always that cranky kind of a person. They unpredictable. When I would give them back, it was like that kind of a situation. So that's when I came across this Isha yoga that has really helped me in managing stress. It's not that we can completely avoid it in the current situation. We can't avoid.
Is more important.
So how do you manage that stress is what matters, right? How do you manage? So with yoga, I have been able to manage stress. I had a lot of balance in my situations, that I look at it as a moment of situation. Okay, it has come, it has come. You can't do anything about it. How do you resolve that is what you need to think about. Right?
More so, it is a learning,
yes.
Learning in your life.
Of course, I think
you won't have success all the time.
Correct.
You will have failures. And what is a failure? Failure is a stepping stone to success.
Exactly. So don't take that as a problem or some kind of a nuisance that is happening in your life, right? It's a learning. It's a situation. Call it as a situation. Deal with it.
Overcome it and go on.
Move on. That's it. I mean, don't sit down and get bogged down about it, keep thinking, crying, disturbing the entire, people that are around you, right? It doesn't really help. So think about it as a situation. Okay, this has come. It's not a problem. It's a situation. You gain experience out of it. That's what I would say. Learn about it. Like how can you resolve it? Solve it, and then you come out as a great achiever. When you look back after 2 or 3 days, you might look at it as a trivial thing that you really bothered about. So I think yoga, spirituality, whatever God you believe in, spend time, invest some half an hour to 45 minutes every day before you begin your day, right? Before you begin your daily chores, invest in that, and that gives you a lot of calming and brings balance in your mind, body.
It also helps you deal with teams much better. You are more wiser, more matured, and know how to deal with people.
Yes.
Apart from yoga and spirituality, what else are your interests?
My interests are like traveling. Nowadays, I have reduced it because I had some situation last year with my health, so I reduced it. But travel, I used to love. I'll start it again. That's
I think we should travel together.
Yeah, of course. And my family, I have 2 boys and 1 pet. So being with them, every weekend we go out, spend time with your family. That's a piece of advice that I would give to the current generation, which doesn't really happen, I see. But
I know the fact and the glory that we are living in India. India is a country which gives a lot of importance to family, unlike the West. I would second what she said. Invest and spend time with family, and that's your fulcrum of your existence. And whatever goes wrong, if at all it goes wrong, they will be there to fall back upon. So invest time with your family. A couple of last questions is, apart from your family and interests that you mentioned, you also do a lot of community work. What do you do, and please explain?
So I am a part-time volunteer with Isha. So we go to villages. We go to they are like in farms most of their time, right? We motivate them to come and invest in their health also. I mean, if we ask the villagers to come and do yoga, they might not appreciate it. So what we have, I have actually partnered with Isha, where there is something called Gramotsavam, which talks about introducing some small games that they play, right? Kabaddi, volleyball, throw ball, and things like that, which everybody is interested. I mean, even the people in villages or towns, everybody alike play games. I mean,
Right.
they would love to do that. So I do a service with Isha as well. So there is also in my organization also there is a CSR activity that we do, corporate social responsibility, where we have something like mentoring. So they are like college
Students,
fresh,
young students.
in their final years of BTech or engineering, where we are tied up with one particular person, and they are from little financially background. They're not as strong in their financial situation, so they can't go and reach out to a consultancy.
Sure.
To
So you're like a mentor for
I'm
them.
like a mentor. I give them tips around how an industry works, what are the skills they have to build on, what are communication, how do you speak to people, what are the kind of tips for them to come into an industry. So they are little in backward in their financial, and also their family background, their parents are not educated. So I have mentored, I have offered myself as a mentor for that particular program,
Group of people.
and I'm currently doing that.
All right. What are the awards and citations you have received so far in your career, Veena?
I would say many.
I'm sure.
With I have 20 years of experience in the
Right.
IT industry, so every team that I work with, there is definitely star awards, spot awards. So I have ensured my team is well recognized wherever I work, in all the consulting firms. Recently I was awarded a star award in my current organization as well, for my attitude and jumping into whatever is offered to me, as with the same enthusiasm. Even if it's a trivial work, I go with the same enthusiasm. So that was a recently, just 2 days back, I received a star award.
Congratulations.
Thank you for that. And many other things, I would say. I think we have also collaborated with the traffic police to build an application for them. The ex-DGP Mahinder Reddy, if you are aware.
Yes.
So Mahinder Reddy, I collaborated with him, we presented the solution to them, and then
Sure.
they gave the project to us. I mean, I take that
That's
pride
okay. Yeah,
for
absolutely.
developing something for the cause of development of the society as well. So that was well appreciated by my organization. I also had some, there were various earthquakes and flood situations as well, corporate social responsibility. So there as well, I was recognized as a key person who has driven that from my organization perspective. So every year there is some award. I don't really crave for
Count
that.
of them.
It's the satisfaction that I get out of
Absolutely,
doing this. I
absolutely.
mean,
It's-
awards
it's
are secondary.
It's kind of a recognition, so
Exactly.
you feel good about
yeah.
it. We have been speaking to Veena so far, and the points that she has mentioned is skill, constantly skill, upskill yourself, learn, reskill yourself. Never look at small things as a trivial job. Always take it as a challenge. Always learn to adapt yourself. I would always say that learn to adapt and adopt in any situation. When I started my career, I was doing data entry, and today I'm the HOD of a department. And it is okay to even do the smallest of jobs like Veena just mentioned. Do not get stressed. Do not say that I can do this only, I cannot do this. Don't slot yourself. Be like an open ocean. You can do everything, and that's how you're constantly learning, growing. She also mentioned about spirituality. She's also mentioned how she has imbibed spirituality to calm herself, to achieve what she wants to achieve. And she's today the HOD of a department. She's leading a large number of people, responsible for large teams, and that is the career path that she has led herself to. She has given a lot of inputs to the young students. So take the inputs, take the examples of Veena and imbibe it in your career. Veena, thank you so much for being our guest today. It was wonderful talking to you.
Same here. Thank you, everyone.
To stay informed about the startup ecosystem, Subscribe to my Startup TV.
Namaste, my name is Jay Chaudhary. I am the founder and chairman for the International Startup Foundation. We started this journey about 2.5 years back. Now what we have taken up a unique project called Ankur Yatra. We believe that India has got immense potential in the rural India. Every problem in the rural India could be opportunity for a startup or rural startup. That's the reason why we want to bring this awareness through the rural startup bus yatra. It's called Ankur Yatra. First time in the world we are experimenting. Many CEOs, CTOs, investors from North America, from Europe, from Singapore, India, they all want to participate. They all want to give back to the country to their own motherland, to their own districts and towns and villages. And this kind of response I never anticipated. It's happening. They are all going to participate in the Andhra Pradesh rural startup bus yatra, Ankur Yatra, which is going to be flagged off on Mahatma Gandhi Jayanti on October 2nd by Honorable Chief Minister of Andhra Pradesh, Sri Nara Chandrababu Naidu Garu. Going to be experiment, a pilot, how rural India we are going to create the startup.